Jaanong re tla nna le motsotso wa tidimalo go rapela kampo go ikutlelela. Le ka nna fatshe. Honorable members, I have been informed that the whipper has agreed that there won't be any motions for today. So we'll proceed with the business of the day. However, before we proceed, honorable members, I just wish to make some comments with regard to the recent behavior of ourselves, because I will include myself as part of the collective. I would like to stress the point that this behavior that we have seen recently is quite unacceptable and have a negative knock-on effect on the decorum of the House. As presiding officers, we have noted that some members have taken upon themselves to want to question, debate, overturn, and in some instances defy the officer presiding. I would like to refer members to the Council Rule 35 and 37, which provides as follows, and I read it. Rule 35, it says, whenever the officer presiding rises during a debate in council, a member addressing or seeking to address the chair must sit down and allow the officer presiding to be heard without any interruption. Rule 37 says the officer presiding may order a member to leave the chamber immediately for the remainder of the day's sitting if the officer presiding is of the opinion that the member is deliberately contravening a provision of the rules. The member is in contempt of or is disregarding the authority of the chair, or the member's conduct is grossly disorderly. Members should be mindful that as honorable members, we are supposed to conduct ourselves in a manner befitting the decorum of this august House. To interject an officer presiding whilst addressing the House, or to call to question the ruling of the officer presiding after it was delivered is totally unacceptable, is tantamount to contempt and or disregarding the authority of the officer presiding. As officer presiding, we have a responsibility to conduct proceedings of the House and to protect speakers on the podium in order to ensure that the business of the House is not compromised. Members might have noticed that we always encourage you, in case of a member is not satisfied with the decision of the officer presiding, to write and bring that matter to the attention of the chairperson of the council. Therefore, there should not be any justification for members who are not satisfied with rulings of the officer presiding to disrupt proceedings of the House. I therefore call upon all members to cooperate with us and to afford us the opportunity to conduct the business of the House uninterrupted. Failure to do this will leave us with no other option but to protect the decorum of the House and enforce the rules. The second part of it, yesterday I committed to look at Hansard and to come back to the House with regard to some rulings where members requested to be ruled. There is a technical problem that we're experiencing with Hansard with regard to those specific rulings, but I shall do that before I leave the chair, or even before the House adjourn, and make rulings insofar as those particular rulings are concerned. The Secretary would now read the first order of the day.
Policy debate on budget vote number 16, health. Appropriation Bill B5, 2017.
In welcoming Honorable Motsoaledi, may I therefore call upon you to introduce the debate.
Honorable Deputy Chairperson of the House, my colleague, the Deputy Minister of Health, Dr. Joe Pasha, and my colleagues, the MECs from Limpopo, KwaZulu-Natal, Gauteng, and Eastern Cape, the Chairperson of the Select Committee on Social Services, Honorable Dlamini, honorable members of the Select Committee, distinguished guests, ladies and gentlemen, good afternoon. Honorable Chairperson, this is the year of Oliver Reginald Tambo. He was one of the most revered icons of our struggle for freedom. He once declared that we have a vision of South Africa in which black and white shall live together as equals in conditions of peace and prosperity. I believe that for us, black and white, to live together as equals in condition of peace and prosperity, we need to make sure that all people enjoy the health dividends of our democracy, as Oliver Tambo would have liked. Yesterday, the Department of Health took a huge steps in our endeavor to make sure that these health dividends of our democracy reach all our people. I have presented a final policy document on the National Health Insurance, NHI, to the joint meeting of all cabinet committees. I am aware that many people are still not sure what NHI actually is. It is something Oliver Reginald Tambo would have cherished. It is something that our forebears in drafting the Freedom Charter in 1955 dreamt of. It is something that the United Nations did not only dream of, but adopted in September 2015 as one of the 17 Sustainable Development Goals, and they named it Universal Health Coverage, using the name that was given to it back in 2005 by the World Health Organization, the WHO. On the week of the 22nd to the 27th May this year, the World Health Organization convened its 70th World Health Assembly. The World Health Assembly is an annual gathering of all health ministers and health experts around the world. Every 5 years, the ministers elect a head of the World Health Organization who is given the title Director General. Such an election took place on the 22nd of May this year in Geneva, Switzerland, where the World Health Organization sits on an annual basis. For the first time in 69 years of the existence of the World Health Organization, an African has been elected as the Director General of this organization. I thought you'll cheer because this yes. You don't have another opportunity of 69 years. I thought you'll applaud. He is Dr. Tedros Adhanom Ghebreyesus from Ethiopia. He and two other candidates, one of them from United Kingdom and the other from Pakistan, were granted an opportunity to address the assembly for 15 minutes before voting could begin. I want to simplify the concept of universal health coverage, or NHI, to you by quoting from the address of Dr. Tedros, the new Director General. And I quote, "I have dedicated my life to improving health, to reducing inequalities, to helping people everywhere live more productive lives. That commitment has driven me throughout my life and career, and it is what brings me before you today. It is that commitment with which today I seek to lead the World Health Organization and serve its noble mandate. And I make the following promises. Promise number 1, I will work tirelessly to fulfill the World Health Organization's promise of universal health coverage. Chairperson, for the sake of time, let me skip promise number 2, 3, and 4, which he made, and go on to explain this promise number 1, the universal health coverage. And I quote further, I quote, last December, I met a medical student in Santo Domingo, Dominican Republic. He suffered from kidney failure and was receiving dialysis 3 times per week. I asked him how much he was paying for it. He said he didn't know. He said the government covers it. Without it, he will be dead. His treatment could have made him miserable, but he was smiling and full of hope. He told me when he completes his medical training, he will work to help others. Because of his access to health, this young man is alive. He will thrive and give back to his community. His story touched me very deeply. He went on to say, universal health coverage represents our most basic common values and aspirations, as you can see from this young man. It is about delivering health and hope to our people and investing in the prosperity of future generations. That is why I always say all roads should lead to universal health coverage. Universal health coverage should be the center of gravity of all our activities. Universal health coverage means, as you know it, quality diagnosis and care, ensuring access to quality drugs, and addressing financial barriers to health. Universal health coverage is a matter of political commitment, and we have to ensure political commitment if we are going to achieve it, close quotes. He went on to conclude, and I open quotes again, I will not rest until we have made good on our promises of universal health coverage, close quotes. So, Honorable Chair, when I presented our final policy document on NHI to the Joint Cabinet Committee yesterday, I was also driven by this ideal. When our forebears in 1955 drafted the Freedom Charter, and under the heading, there shall be housing, security, and comfort for all, they said a preventative health scheme shall be run by the state. And they also said free medical care and hospitalization shall be provided for all, with special care for mothers and young children. They actually did not know or could not have guessed that 60 years down the line, this concept will be adopted by the whole world at United Nations and call it universal health coverage. The predecessor to Dr. Tedros, the Director General who we voted into office in 2012, Dr. Margaret Chan, she said, and I open quote, universal health coverage is an equalizer between the rich and the poor. It is an ultimate reflection, the ultimate expression, of fairness, close quote. So how do we actually define universal health coverage? It is a health financing system that pools funds to provide access to quality health services for all South Africans based on their health needs and irrespective of their socio-economic status. This definition, Chair, may as well fit the definition of a medical aid, but there are two very notable exceptions that made NHI and medical aids look like chalk and cheese. The first exception is the word all, because under NHI, we intend to pool funds for all South Africans. In medical aid, the word all does not exist. Medical aids are designed for a selected privileged few and pretend that the majority of South Africans do not exist. And all of you in this house today, unfortunately, you are part of that privileged few. That includes me. Since 1967, when the first act to consolidate medical aid scheme was enacted by the then apartheid government, which came into power in 1948, Medical aid schemes have only served 16% of the population up to this moment. Hence, according to that system, 84% of South Africans have no right to access to good quality health services, and they can be served through some other alternative. The second notable exception is the word irrespective of socioeconomic status. Under the medical aid system, even the selected privileged few, which you belong to, are stratified according to your economic status, even inside that system. The more senior the job you perform, the higher your salary, the better the quality of health services you get. The more junior your job status, the lower your salary, the lesser the quality of health services you get. This cannot be allowed to go on any longer. It is a flagrant disregard of our Constitution, because in our Constitution, the Constitution does not recognize economic status in the provisioning of health services. It is also a flagrant disregard of our Constitution, because under medical aid, health is a condition of employment, whereas in the Constitution, it is a right. When the United States universal, they mean all. They mean no one shall be left behind. So NHI is going to be exactly that. And the document that is going to be brought to you after the cabinet finally approves it next week shall reflect that we have now started on this noble but difficult journey towards equalizing health between the rich and the poor. High blood pressure is high blood pressure. It cannot be treated differently between a rich person and a poor person. It can't. Hence, Honorable Deputy House Chairperson, NHI represents a substantial policy shift that will necessitate a massive reorganization of the current healthcare system, both public and private. And I want to repeat this. We are going to massively reorganize the present healthcare system in order to meet the ideals of NHI. We will outline in detail when the cabinet has adopted the final document, when we come to you and give it to you, because it must then pass into a law, we will outline in detail what actually we mean by this massive reorganization, because this policy shift has never taken place in our country before, nor has it ever taken place in many parts of the world. It's completely new, this concept of universal health coverage. In conclusion, I want to inform you that in January this year, the World Health Organization established a movement in Geneva because they set for this concept to be driven around the world. We want a movement reminiscent of the movements that were formed to fight HIV/AIDS. The strong movements, which everybody knows around the world, has been formed in Geneva to drive the principle of universal health coverage all over the world. Chairperson, I'm presenting to you this budget of 42,625,723,000 rand for 2017-18 for adoption by this House. Some people were looking at me, they thought I would trip on these numbers. I never did. 42,625,723,000. That is the budget of health. Thank you very much.
Thank you very much, Minister. Honorable Tlamin.
Chairperson, the minutes that were left by the Minister will be added to me. Thank you very much, Honorable Deputy Chair. My greetings to the Honorable Minister and the Deputy Minister, honorable members, MECs from different provinces, special delegates. Honorable Chair, the health status of any country is considered as a key precondition for long-term economic growth, as well as an outcome of sustainable economic development. Improving the health status or the health outcome of citizens is thus a key social economic development goal for most countries. It should not only be seen as something that you are healing a person. Honorable Chair, the committee support the budget as presented by the Minister for simple reasons. that in 1990, Chair, the life expectancy amongst white South Africans was 69 years for males and 76 years for female. By contrast, life expectancy amongst African was 60 years for male and 67 years for female. At birth, the probability was that the life of an African female would be 9 years shorter than of a white female. The indicators also shows that in 1995, the infant mortality rate amongst Africans, it was at 48.3% per 100 lives birth. That means that it was 6 times higher than that of white, which was at 7.4% per 1,000. This simply means that prior to 1994, public health services were only available to a small portion of the population, while the majority of Africans had inadequate or no access to health care. The disproportionate allocation of resources was mirrored in life expectancy figures of the different racial group, meaning that, Chair, you had to have a lighter skin to be given health care services at the time. Over the past 23 years, Chair, there has been a major transformation that has taken place in South Africa in health legislation, policies, and the delivery of services to all South Africans, irrespective of color, whether they are rich or poor. All South Africans are given health services equally. In recent years, the South African government has introduced a universal health coverage known as the South African National Health Insurance. This initiative seeks to ensure that all South Africans have access to good quality health care, irrespective of their financial status. Honorable Chair, South Africa has been grappling with the scourge of HIV and AIDS and TB for many years. Recently, the country has been making good progress in addressing HIV and AIDS and TB. To this end, it is worth noting that mother-to-child transmission of HIV has been reduced. However, the number of new infections in young girls and young women aged 15 to 24 are still very high. It is plausible to note that there are much needed intervention currently done by the department. We really appreciate that, Honorable Minister. Furthermore, the National Development Plan aims to have an AIDS-free generation of under-20s by 2030. To this end, the department has announced 2 major plans to be implemented during the current financial year. One is to provide access to ARVs treatment to any confirmed HIV positive, meaning that they are not going to wait for the CD count to be at a certain level. The other one, to provide pre-exposure prophylaxis to sex workers. We also note the improvement in addressing drugs short outcomes, which has been a problem for a while in the country. The department has embarked on a proactive strategy called Stock Visibility System to address the medicine supply challenges in all our health facilities. Honorable Chair, we've been to different provinces, even in the poorest of the poor areas, where there are serious challenges, but in terms of drugs availability, in all the areas that we visited, there has been drugs available for our citizens. While recognizing the progress made by the National Department of Health in delivering quality healthcare services to the people of South Africa, challenges still remains, especially at a provincial level. In this current financial year, 2017-2018, the South African healthcare system indicates that there is 45,733 vacant posts, and 351,925 filled posts. This presents a shortfall of 11.5%. Chairperson, you can do whatever you can, but if you don't have enough personnel to implement your programs, whatever program is bound to fail. The most affected province, Honorable Chair, includes Limpopo, that has the highest number of vacant posts at 10,074. And the Eastern Cape has 7,005 vacant posts, Gauteng 6,100. We are therefore saying, Chair, these posts are very much important to be filled. I don't know what are the challenges for the provinces to fill those vacancies, but we are saying whatever plans they have are bound to fail if they don't have enough personnel. The post includes those for doctors, nurses, optometrists, audiologists, administrators, psychiatrists, financial and hospital managers, and maintenance works. As we've been going around, we've realized that most of the challenges in infrastructure is maintenance. So if there are still vacant posts to be filled of people responsible for maintenance, Chair, we don't know what is the problem in filling those vacant posts. Human resources is the most critical component in delivering quality healthcare services to the people. Therefore, there is a great need to fill the vacant post within the Department of Health, especially at provincial level. Honorable Chair, in 2016-17 financial year, healthcare spending was increased by only 5.6%, and provincial hospital services faced a 2% cut, amounting to nearly 600 million. When the healthcare inflation rate is taken into account, which according to the medical aid scheme was 11%, the health budget for provinces in real terms was cut by 13%. While we recognize the country is in a difficult financial situation, it is critical that health allocations to provinces should not only meet rising costs, but must also be increased in real terms above inflation to ensure that improvements of services is realized. Honorable Chair, as the NCOP, we've been to Free State to do a pre-visit in one district, Harib district. There, the infrastructure, Honorable Minister, we're not doing good at all in that district. Most of the health facilities or the clinics are houses that were converted to clinics. Not only that, we are also requesting the minister to engage the Minister of COGTA, because all health facilities there were affected by water cuts, by Bloom Water, because the municipalities has not paid. During our visit, most of the health facilities, including hospitals, did not have water. So we're requesting the minister to engage with Minister of COGTA to deal with that issue. It should not affect the citizens. You cannot imagine a hospital running without water. That has to be addressed. While the country's health facilities have serious challenges in most of the provinces, especially in rural areas, we have also seen the budget cuts in the infrastructure budget. So we are just asking ourselves, how are these challenges going to be addressed? We are also requesting the minister to engage the National Treasury to talk about these cuts and how they're going to make up on the infrastructure that is challenged in our provinces. The recent life Esidimeni tragedy highlights the vulnerability of mental health care users in Gauteng. We all remember the issue of life Esidimeni. The Gauteng Department of Health used limited funds as an excuse for discarding mental health care users, which led to the death of over 100 mental health care users and the neglect of over 1,000 such users. While the mental health budget is not in itself detailed in the budget. We're just asking ourselves that if this is not taken as a priority, are we not going to see other challenges and also in other provinces? Honorable Chair, the Department of Health aims to improve district mental health facilities, where each district would look at the key clinical priorities. However, there were limited people in the psychiatric profession. We are proposing, Honorable Minister, that could you not consider providing bursaries for people who are dealing with psychiatric cases, so that, and with the condition that when they finish for a limited time, they support the department. Honorable Chair, we also visited, I'm not going to cover all the issues that the minister has covered. We also went to Mpumalanga recently as a committee to do our oversight. One of the topical facility was Rob Ferrella. Honorable Chair, we have learned that most of the issues that were raised on Rob Ferrella were addressed, raised by the previous committee, were addressed, except 3 issues. The first one was the staff attitude. The second one was the long queue at the reception area. People wait for long. And then the third one was the mortuary. It's very small. In fact, the mortuary there is only taking 12 people. And we feel that it is very small, as much as we know that there are private facilities, but for a government hospital, a mortuary that can only accommodate 12 people is not big enough. Then we also had experienced budget processes challenges in this financial year, that is in Mpumalanga. However, the Mpumalanga Health Department will continue to provide the resources to expand opportunities for people to access quality health care services in the provinces. The challenges that we learned in Mpumalanga is that these are the following challenges that we learned that they're experiencing: the slow contractor performance, reworks emanating from poor quality of works, social protests resulting in disruption of works, and the change of scope of work, which means that there has to be more budget allocated for a project. Delays in approval and connections of services such as electricity and water, appointment of new contractors after termination of poor performing contractors, then also the lack of capacity within the Department of Public Works. But we also experience a number of projects that are implemented by the department in Mpumalanga, especially hospitals that are being revitalized by the province. We therefore, Chairperson, as a select committee on social services, support the budget, and we are saying we will continue to support the Department of Health and its provincial department to work towards its improving the quality and the access of healthcare through the introduction of the National Health Insurance and other services that are provided by the department. We support the budget, Chair. Thank you.
Okay, thank you very much. May I call on Honorable Mpambo Sibukwana?
Ndisibulisele kuwe Sekela sihlalo walendlu yengwevu. Okokuqala mandithi mphathiswa, ilizwe lethu libeki inxalabo enkulu neliso libukhali kubaluleko nokukhathalelo lwezempilo kwanophuhliso kwisebe lezempilo. Nangona kunjalo urhulumente ubonakalisa esilela kwesi sigunyaziso ingakumbi ezilalini. Ngokwengcinga zethu mhlali ngaphambili, kungangcono sonke sibeke iliso elibukhali ngokufezekisileyo nalapho uthe wasilela khona urhulumente ukuze siqonde imikhombandlela ethile emasiyilandele nemiba emasiyikhanyisele umkhanyo. Into entle iyanconywa xa funeka inconywe. Simothulela umnqwazi urhulumente ngenkxaso we-14.4 yezigidi ngezigidi billions mpilo yoluntu lwaseMpuma Koloni. Nangona kusenokuba indleko enkulu, inyaniso engafihlekiyo into yokokuba kufunyanwa uninzi labantu abatsha abazingcaphephe ezintsha kwezempilo nabasebenzi jikelele evaleni izithuba zengqesho ezingekhoyo kumaziko angama-300 ezempilo yoluntu kwiphondo jikelele. Sifaneleke ukuba sichwayitele loo nto. Nanjengokuba iMpuma Koloni liphondo elaziwa njengelineenkonzo ezingekho mgangathweni kunikezelo lweenkonzo kuninzi kule mimandla yayo asezilalini, into yokuba ingakumbi kumaxesha akudala kusilele kakhulu ingakumbi nangakumbi. Ngoko ke sibothulela umnqwazi Mphathiswa Motsoaledi ngokugqweswa kulomba kweli phondo leMpuma Koloni. Iinkonzo zeambulance zezithuthi zezigulane ngomnye umba obalelekileyo Mphathiswa Motsoaledi kakhulu. Usarhuqa umrhaji phaya ezilalini oku ngoba abantu njengokuba kukho iziphako ekufuneka zihlatywe amadlala kungentsuku zatywala malunga nonikezelo ngeenkonzo lexesha likaxakeka elithile apha eMzantsi Afrika zithi zifika kwaba bantu ezilalini libe itshoba lilalimbethe, ingakumbi kwindawo ezifana neGarib Dam lesisandukufika kuyo. Siyivile loo nto xa besichwechwele phasi sityelele phaya, ingakumbi phaya eMpuma Koloni. Oku kuthetha ukuthi izigulana zifumana ingxuba kaxakeka ekufumaneni izithuthi ngokwexesha. Izigulane esengxingweni ingakumbi emaphandleni zithwaxwa yintlupheko ngenxa yokunqongophala nokusilela kwezi nkonzo, yaye lilungele into yokuba mabazifumane ngokwexesha mhlali ngaphambili. Isibhedlele somgangatho wesithathu esisefere eMpuma Koloni safumana amanqaku angama-42.2% kuvavanyo lolawulo lokusuleleka. Saphumelela ngama-80 eepesenti, okuthetha ukuthi izigulane zisemngciphekweni wosuleleka ngethuba lisesibhedlele. Isibhedlele sasePLENARY eFreystata sasilela ukuhlawula ngamaziko kwamagumbi ezigulane anesifo sephepha, TB, nesosulelayo. Ingxoba kaxaka ke mhlali ngaphambili le yokuba kukho amaxwebhu namaphepha angameselekanga abhalwa ngoogqirha nabaphathi abakhulu besibhedlele, kwafakwa isebe lamaziko onyango kumatyala asezingudleni ngokwasemthethweni ngethuba isebe limanxadanxada liyintlawulo ye-48 million. Kuyo yonke ke loo nto yamabango ezonyango ngokwasemthethweni kwisiqingatha sesithathu sonqongophalo lonyaka, ukubhala kwamaxwebhu la amaphepha angamiselekanga kwezi zibhedlele zikarhulumente kwenza kube lula kakhulu ukugqwesa phambili nokuphumelela kwabo bafaka amabango oncedo lwezonyango okusebenza ngokungenankathalo kunye nasekufumaneni intlawulo yemali. Le mali ke mhlali ngaphambili le bifanele ukusetyenzisela unikezelo lweenkonzo ebantwini iye ebantwini kwezonyango ezisemgangathweni kwabo bangathathi ntweni nabo bazimpula zikalujaca beli lizwe. Le mali ke yile bifanele ukusetyenzisela ukuhlangula ubomi babantu, kepha ayiyi kuloo ndawo, iya kwaba bantu basebenza ngokungakhathaliyo ze ibabhatale ezinkundleni zamatyala. Nangona kunjalo kufuneka sazisiwe ngezinye iindleko ezikuthwalisa amaziko umoya nezithe zenziwa ngurhulumente. Kutsha nje kulo nyaka urhulumente uchithe isixamali sezigidi esiyi-1 billion kwintlawulo ebangelwa kukwenziwa kumabango ngenxa yokungabi nankathalo kwezonyango kwisebe lezempilo laseGauteng Province. Lo umba mawungabethwa ngoyaba mawuthathelwe ingqalelo mhlala ngaphambili. Ingxowa-mali ye-inshorensi yezempilo kazwelonke uthethile umphathiswa ngayo NHI ayibanga inkcitho mali engenasiqhamo kuphela kodwa nangaphandle kokuba isisixamali esingakanani naxa esithe safumaneka sihlala singonelanga kwaphela. Nangona ingxowa-mali iyimfuneka kakhulu kubemi boMzantsi Afrika abathi gqolo bezimpilo zikalujaca bengathathi ntweni beyimipha eqhutywa yalahla phambi koncedo lezempilo kwezokubelekisa, kwezempilo ezikolweni kwanokusekukhubazekeni kwabantu kuseyimfuneko ebanzi kakhulu. Uthi ke umphathiswa xa beyithetha loo nto ade anabele naphaya kumba woxinzelelo legazi, the high blood pressure, uthethile ngayo. Njengaba kumanyano lolawulo lesininzi apha kweli phondo ndikulo, sibongoza ubuchule obu bobunye kwinkcitho yesebe. Endaweni ukuthi gqolo kuhlahlo lwabiwo-mali kwimiba engenafuthe, sikholele ekubeni nakulo unyaka lolwabiwo mali mawunikezele umgangatho onemiqathango esuka kurhulumente kuwo wonke amaphondo sikwanalo neqhayiya sizingca ngakumbi nangakumbi ngeenkonzo zoncedo lokuqala kwezempilo nasemgangathweni zixhaswa kulawulo olufanelekileyo kuzo zombini inkqubo zommandla nezamaphondo ngokunxulumele nokufikelela kwinkathalelo kwezempilo ulwazi lwethu lulandela umkhondo wokuba lolona libonakaliso okokuba phantsi kolulalo le-DA apha eNtshona Koloni yinkungu nelanga abantu abanako ukufikelela kukhathalelo lwezempilo inyaniso engafihlekiyo yokuba inani loqikelelo lobomi bokuphila kwintshona Koloni eliphantsi kolawulo lwe-DA liyiminyaka engama-66 ubudala xa kuthelekiswa nemyingo ophakathi kwezikazwelonke weminyaka engama-62 njengombutho wezopolitiki siyawuqonda umba oyingxuba kaxaka we-HIV and AIDS kweli lizwe kungenxa yokuba sixhasa inkalo yojoliso ka-1990 yombutho lwezempilo wehlabathi ngowama-2020 sijonge into yokuba kungafuneka iziphumo zoxilongo zabantu abangama-90% bafunyanise benosuleleka abangama-90 kwabo benosuleleka befumana uncedo lonyango nokuthomalelisa ukusuleleka kwentsholongwane kagawulayo inkcitho yesixamali esinganeno kuncedo lokuqala lwezempilo noqingqomali lwezempilo kuthetha ukuthi akukabikho manatha wokuthungela lwezempilo ngokumeleleneyo kunikezelo lweenkonzo zezempilo kubemi baseMzantsi Afrika kwindawo ezikufuphi namakhaya abo ngakumbi ezilalini iinkonzo zezempilo ke mhlawumbi ngaphambili zobelekiso ngumba ongundoqo nesuhlabela ikhwelo ngenxa yenani lentsana ezibalelwa kumakhulu angama-53 ezithi zilalithoba uMzantsi Afrika kwikhulu ngalinye lentsana ezizeleyo ulwabilo elimali lenkqubo i-HIV ne-AIDS nobelekiso nokhathalelo lwezempilo sisixamali esiyi-18,278,000 sithi ke okungenelanga kwaphela uncedo lezonyango lobelekiso ngumama ndigqibezele mphathiswa unyango lezobelekiso alufumani ngxowa-mali yoncedo ngokwaneleyo eMzantsi Afrika ngenxa yoku ke rhulumente ongathetheli ingqalelo kwinto ethethwayo phathiswa xa besinentlanganiso yabahlali bacelile phayana into yokuba sidlulise umba wokuba njengoba ile nyanga yesilimela uJuni amakhwenkwe ezawungena esuthwini isini sam siyanqanda into yokuba ndinyathele kwezinye indawo malunga nalo mba kodwa bacela into yokuba wolule isandla ufake oogqirha abangamadoda ngoba bayasilela ekuthetheni badlimu xa befike kwiinesi ezingomama xa kufike kule nyanga ndiyabulela
Wevile ma. Thank you very much. Honorable Zwane, can you continue the debate?
Ngiyabonga sihlalo ohloniphekile wendlu ngibingelele uNgqongqoshe isekela lakhe ngamalungu ahloniphekile eParliament izivakashi no MEC abavela kumaphondo ngiyajabula ukuba ingxenye yale nkulumo mpikiswano esiyenza ngesikhathi esibalulekile ngenyanga yentsha siyazi ukuthi izimbili kuphela insuku ezisele ngaphambilini basifike kuJune 16 ngeke salikhohlwa igalelo lentsha yaseningizimu neAfrika eyafa eningilayo ngama uprisings aseSoweto ifela ukuthi abantu baseningizimu baze ngelinye ilanga baphila impilo engcono mhlawumbe ukuba intsha yethu ayilwanga ngaleso sikhathi mhlawumbe ngabe ngiyaphoqeleka namhlanje ukukhuluma ngesibhunu ulimi labacindezeli kodwa ngoba zalwa ingane zethu siyalibonga kakhulu igalelo lenkulumo futhi yenzeka ngesikhathi nangonyaka la sikhumbula khona umzabalazi wangempela wenkululeko ubaba uOliver Tambo owalwa elwela inkululeko owaba ngumholi onohlonze kaAfrican National Congress isikhathi eside njengopresident weANC kusukela ngo1967 kuya ku1991 Siyalibonga igalelo lakhe nenkulumo yakhe yokusikhuthaza eyayithi asingeke size siphumule umuntu omnyama engakaphili impilo afanele ba ayiphile la kulelizwe lethu esilithandayo. Phakathi kwentsha engifisa ukuba siyikhumbule intsha enjengo Andrew Zondo. Ngijabulile nje izolo ma umhlonisha uNkwinti ekukhumbula lokho ukuthi intsha enjengo Andrew eyafayo eyagwetshwa intambo ngoba nje kwakunecala ayilibekwa lokuthi uyena ofake ibhomu lapha eManzimtoti edolobheni labelungu eKZN ngoba abelungu kade benze iraid lapha koLesotho babulala abantu abawu9 uma seqhuma ibhomu eManzimtoti sekuthiwa Andrew Zondo wagwetshwa emncane wagwetshwa isigwebo sentambo intambo yakhe yayintambo izigaba ezisihlanu kusho ukuthi isidumbu nesidumbu esaphuma kwakuyisigwebo sentambo sithi ke lezo zimo akeke sayikhohlwa ngoba lezo ingane naleyo nje uyafela ukuthi sibe la sikhona namhlanje alale ngokuphumula nabanye ozakwabo afana bongalizo sikhathi. Uma ke izwe uzolibheka ukuthi lithuthuke kangakanani uzobheka ukuthi abantu balapha kulelo lizwe bafunde kangakanani uzobheka futhi ukuthi ezempilo zakulelo lizwe zisezingeni elinjani uzobheka futhi ukuthi umnotho wakulelo lizwe usezingeni elinjani. Siyabonga ke la eSouth Africa ukuthi uhulumeni kaKhongolose wenze ukuthi abantu baseNingizimu neAfrika bakwazi ukuthola izinga lezempilo elisezingeni elifanele ngaphansi kwemigomo yemali esinayo. Siyakubonga ngqongqoshe nomnyango wakho nohulumeni wonke waseNingizimu neAfrika ukuthi nifake lolu hlelo okuthiwa iNHI okhulumile ngalo. Le NHI yenza ukuthi wonke umuntu akwazi ukuthola usizo lwezempilo noma ngabe isigwili noma ngabe umpofu akwazi ukuthola usizo ngendlela efanayo ngoba uhulumeni efuna ukuthi kuphela le yanto yobandlululo eyenza ukuthi izinga lempilo elinikwa abamhlophe libe phezulu bese ukuthi abantu abamnyama bangahlelelwa inhlobo udaba lwezempilo nezinga lokuthola imishanguzo. Iphelileke lonto ngalohulumeni okhona kaKhongolose. Siyabonga ukuthi emzabalazweni wenu wezempilo nikwazile ukukhulisa inani lokuphila komuntu. Ngesikhathi sengcindezelo abantu babephila isikhathi esincane mhlambe umuntu aphile nje kufike la ko54 years kodwa kuthe ngathatha nina nakwazi ukukhulisa iminyaka lokuthi siphile siphile isikhashana sibe side sifike lapha ko62 63 years ngani ngoba nikwazile ukulwa nezifo ezinjengengculazi nesandulela nakwazi futhi ukulwa nesifo seTB ekade siwumashaya bhuqe ngemali ebe niyabelwe ukuthi nidlulisele leyo mshanguzo. Siyabonga ukuthi nikwehlisile futhi ukufa kweingane ezincane. Izingane ezizalwa zingasekho izinga lehlile ngendlela esimangaliso. Ingane ezifa phakathi kweminyaka owodwa neminyaka esi5 lehlile izinga nelehlisile izinga lokufa kwalezo zingane. Nalehlisa futhi izinga lokufa komama bebeletha. Akuseyo namanje into evamile ukuthi umama mayiphumile obeletha kuthiwa inyanda ibuke nesibopho. Isikhathi esiningi omama babephethe ingane zabo bephila neingane zabo ziphilile. Liphindile futhi nalwa nesifo sofuba ebekade siqeda abantu. Siyalibonga futhi uhlelo lwenu lokungena ezivumelwaneni namanye amazwe ngokubonelela isimo sokuthi isimo sezempilo ufuna basithuthuke amazwe anjengoCuba nenza inhlelo zokuthi kube khona odokotela abaphuma la eSouth Africa baye eCuba bayoqeqeshwa beqeqeshelwe ubudokotela khona bezobuya kuthi ngamakhono abawaqoqe kulela lizwe bakwazi ukuthuthukisa izinga lezempilo laseNingizimu neAfrika. Ngenkathi sisekomitini nomnyango wezempilo ngiyakhumbula sitshelwa ukuthi abawu800 odokotela ngonyaka ozayo bayabuya eCuba kusho ukuthi liyakhuphuka inani lodokotela abazoba semaklinikhi nasezibhedlela ngenxa yokuzabalaza nokusebenza kukakhongolose. Amaklinikhi le idea yokuthi kube khona lokho okuthiwa ngesilungu ideal clinic nokuhleleka kwamaklinikhi besithi masingena koMpumalanga singena ko-Free State ko-Harib sibone lolu hlelo lolu lwe-ideal clinic ama-systems are gelling la abantu bezothatha khona imithi kukodwa la bezobona udokotela kukodwa la bezothatha imishanguzo ethile yo-ARV kukodwa nihlelile. Nonetheless ngqongqoshe siyafuna ukubeka ukuthi zikhonyana indawana sesebenzile sinjalo kusafanele siyilungise njengesikhathi abantu abasilindayo emaklinikhi ngaphambi ababona nurse noma udokotela sisathanda ukubaside besithi masifika la kule ndawo sifika abantu bekhala bethi mhlambe sifikela ngo7 seko12 asikakwazi ukungena sibone udokotela noma unurse. Enye inkinga ekhona emaklinikhi lawa akuma rural areas kakhulukazi ngqongqoshe inkinga yokuthi odokotela okuyibona abasevisa lawo maklinikhi abekho kahle. Bofika uthola ukuthi udokotela eklinikhi ethize mhlawumbe eMpumalanga kufuneka afike insuku zibe 2 esontweni uthola ukuthi udokotela mhlawumbe ufika usuku lube lunye emasontweni amabili ngenxa yokushoda kodokotela. Mhlawumbe labo dokotela bazofika baqedela uqeqesha kwabo ngaphakathi ezweni bazokwenza ukuthi lesisimo sikwazi ukuthi selapheke. Namafayela ke iziguli ofika uthola ukuthi mayifuneka awekho akwazeki kahle ukuthi ayephi zonke lezo zinto kufanele zilungiswe kumbandakanya nokwebiwa kwemishanguzo. Sibonile la komabona kude ukuthi khona lama syndicate acekele uhulumeni phansi ukuthi uhulumeni ekhiphe le sabe umali kadusisho ngqongqoshe so kuyosiza abantu ngaphandle kuthenga imishanguzo kuphilisa abantu nayo yonke equipment edingekayo lapha kwa medicine kube khona abantu abakuma syndicate okweba imithi yabantu sithi labo bantu umthetho uzobagoqa ngeke baqhubeke isikhathi eside. Nanokuthi ke ukuphatheka kweziguli ake ngibhekise nje kungqongqoshe wami wase KZN mase ngikhuluma ngalolu daba ngoba simele abantu asizukusho okuhle kodwa iKZN health system is very good and I know that my MEC is very passionate about health issues. He is a doctor himself. Nonetheless, MEC, there would be those hospitals that need your closer attention. In Northdale Hospital, Pietermaritzburg, can you please pay your attention to that hospital? Ukuphatheka kweziguli akuhambi kahle. Iziguli zilinda isikhathi eside zingaka admitwa mhlambe udlula usuku umuntu engakangene odini egula kakhulu. Ngiyocela ukuthi pay your close attention to that particular hospital. Isibhedlela sasePotchefstroom. You have built a very big provincial hospital there. Kodwa there are challenges. Kumanze sishile isibhedlela. I don't know whether the occupational health and safety systems were in place, but please, I would request that you also pay close attention to those issues. Ngokuphela ke kwesikhathi ngizoma lapho kodwa ke ngifuna ukusho ukuthi ke usetshenziswe ezempilo zisezingeni elifanele sihlula nje imali yanele siyayisupport ibudget siyikomiti. Ngiyabonga.
Ngiyabonga. Honorable Janji, Eastern Cape MEC.
Honorable Deputy Chairperson, Honorable Minister of Health, Dr. Mtsoledi, Honorable Deputy Minister, Dr. Pasha, my colleagues, MECs from other provinces, Chairperson of the Select Committee on Social Services, Medla Mini, Honorable members of the Select Committee, Honorable members of the House, distinguished guests, ladies and gentlemen, good day. Honorable Chair, let me express my gratitude to this distinguished House for granting us the privilege and opportunity to debate Health Minister's policy and budget speech. Honorable Chair, allow me to also appreciate the governing organization, the African National Congress, for continuously displaying its commitment and accountability to the people of South Africa, together with its public representatives, who timelessly come to the Legislative Assembly to give an account of the people's work. Through accountability, we are able to see where we are going, and with this government, we are definitely moving South Africa forward. Honorable members, it is without any shadow of doubt that our government has come a very long way to transform the livelihoods of our people as far as their health is concerned. Today, more people have access to all levels of care, accessing healthcare services from the best doctors and nurses, professionals, irrespective of their socioeconomic status. In the Eastern Cape province, we've put aside 14.4 billion for compensation of employees. Minister Motsoaledi's speech illustrates how the department has unpacked government plan to improve the country's healthcare service package for the benefit of all South Africans in order to accordingly change their lives for the better, as well ensure that they too experience a quality lifestyle. Nelson Mandela, in one of his speeches, once said, I quote, "There is nothing I fear more than waking up without a program that will help me bring a little happiness to those with no resources, those who are poor, illiterate, and ridden with terminal disease," close quote. I'm pleased and honored to be associated with a government which cares for its people and has a plan to transform their lives for the better, living up to the vision and aspirations of our forebears and freedom fighters such as Utata Nelson Mandela. With all the work we are doing in the health sector, with a clear conscience, we are able to say we do not live with and have the fear of failing our poor and ill people, which Tata Mandela referred to, but have a plan to transform their lives for the better, living up to the vision and aspiration of our leaders. I'm extremely humbled that we take stock and note the department's progress at the time when we honor our stalwart and freedom fighter, Utata Oliver Reginald Tambo, who was a firm believer of equality and respect of human rights. Honorable members, I congratulate the Minister's posture on the national health insurance. Indeed, the preparatory phase of NHI has been a successful learning journey, which has brought many positive changes in our communities. In the Eastern Cape OR Tambo Pilot District, we can attest to the success of this program with visible infrastructure, improved services, better access to medicines, as well as running of our facilities. Honorable Chair, in preparation for the NHI, we are making good progress in preparing health facilities to be ideal clinics through the Ideal Clinic Realization and Maintenance Program. Taking lessons from the pilot sites, we have moved to the second pilot site to ensure that more and more of our people enjoy the benefits. We have resolved to further roll out elements of NHI through the entire province to ensure that all districts benefits. I therefore agree with the Minister's sentiment that the time for change and move towards economic equity has now arrived. Honorable members, our province is making good advances to enforce our management of both clinical and administrative records for purposes of improving our effectiveness. The new initiative by the department, working with CSIR, Department of Science and Technology, and Department of Home Affairs, for patients' records and unique patient identifier, will surely enhance service delivery efficiency and effectiveness in health. We are looking forward to its full implementation. Honorable Minister, we have made significant progress in provision of adequate infrastructure for health. I'm pleased to share with this August House our progress with regards to infrastructure development at the OR Tambo NHI Pilot District. We have completed over 10 clinics. Outside the pilot districts, we have also completed facilities which are now ready for use. Our Cecilia Makiwane major project has reached its practical completion stage, and the site has now been officially handed over by the contractor to Premier Muswale. This 1.3 billion flagship project is a noteworthy step towards NHI readiness, as it is a platform where our people will access high-quality services right at their doorsteps. Honorable members, similarly to infrastructure, availability of efficient emergency medical services is essential for health, as EMS provide the initial medical assistance to patients in accident scenes or any other medical-related emergencies. Accordingly, in May 2017, we distributed 32 4x4 brand new emergency vehicles, 21 medical response vehicles, and 11 patient transport vehicles across the province to beef up our fleet on the ground, as well as emergency service effectiveness. Honorable members, in the Eastern Cape, we took note of successes drawn as a result of the World Health Organization's 1990 strategy on HIV, STIs, and TB, and we will continue its implementation during 2017-18, even beyond management of HIV, STI, TB, and HIV counseling and testing, in order to improve the HIV testing coverage in the province. We'll also adopt the 1990 strategy to expand it to other chronic conditions, such as diabetes and hypertension, as a way of managing and treating non-communicable diseases. In conclusion, honorable members, the African National Congress continue to give priority to health as provision and access to quality health care. In this regard, under our minister's leadership, we're committed to working even harder to ensure that the citizens of our beautiful country benefit from our efforts. Through our dedication and unified effort, we will surely achieve our Vision 2030 objectives, as well as sustainable development goals. With those words, Honorable Chair, I welcome the National Health Department's 2017 budget vote. Thank you.
Thank you very much, MEC. Honorable Shabangu. Are you standing in for Honorable Shabangu? Where is she? Oh, here you.
Yeah. Deputy Chairperson, Minister, protocol observed. Honorable Chairperson, the Economic Freedom Fighters reject budget vote 16 on the Department of Health. The EFF aspires for an accessible, high-performing public health system that ameliorates health disparities and provide quality health care bolstered by the multi-sectoral mobilization under adept management, leadership, and governance. Unfortunately, South Africa is very far from achieving these ideals. Firstly, public health sector is littered with examples of poor leadership, neglect of the public health care sector, leading to the preventable deaths among the poorest and most vulnerable of our people. The South African Health Review, published by Health System Trust in November 2016, identified 3 key fault lines in implementation underpin the relatively poor performance of our health system and are impending realization of improved health for the nation. These faultiness are tolerance of inaptitude and failures in leadership, management, and governance, a district health system that does not adequately drive the delivery of primary health care, and the unsolved health workforce crisis. This constitutes a conjoined threat to the feasibility of national health insurance, especially in the Free State where everybody is acting. When are we going to have permanent people working? Seemingly posts are reserved for cadres. Secondly, good quality health care remains inaccessible to the vast majority of people who do not have access to medical aid. Only 17.4% of all the population is medically covered, and that is just 9.4 million people, leaving 45 people without cover. Furthermore, only 10.5% of Black African people are covered by private medical insurance, compared to 72.7% of white people. Can you protect me, Chairperson? To highlight the depth of the problem, there are 25 state doctors and 92 private sector doctors per 100,000 people in South Africa. This therefore means that if you have money and can afford private medical care, you are more likely to get help than if you are poor, Black, and have no other option but to use the public health system. While this paints a very bleak picture, the South African Department of Health continues as if it's business as usual. It is also for this reason that the implementation of the National Health Insurance is so critical. To this day, it is not clear when NHI will be implemented. It is not clear where the budget for the implementation of NHI will come from. But more seriously, under the conditions we have just explained, it will be difficult to implement the National Health Insurance. There needs to be a massive systematic focus on refurbishing public hospitals, on ensuring that these hospitals are resourced with good quality doctors and nurses, with properly qualified management that can respond to issues faced by our people on the ground. Many rural hospitals have just one or no permanent doctor. An example is a Lady Brand Hospital in the Free State. Between 70% and 80% of doctors also prefer not to work for the state, but the main reason for this is not poor pay, but poor working conditions. Other reasons include a lack of equipment and medical provisions, a heavy workload and insufficient protection against HIV and tuberculosis infection. This is a crisis, Minister, and despite some of the commendable work you have personally done, that we have seen, the problems relating to healthcare in this country are structural and require that fundamentally you must lead a process to restructure healthcare in this country. That must entail the dismantling of the divide between the public and the private healthcare sector. The country must have one healthcare system that takes care of all South Africa and South Africans For this reason, therefore, the EFF rejects budget vote 16. Thank you.
Thank you very much, Honorable Chabangu. And on that, Honorable Chabangu, you must give my regards to Honorable Matevula, because I thought you were Matevula. Okay. No, thank you very much. May I therefore call on the MEC for Gauteng, Honorable Lamakop? Just before you speak, Honorable Lamakop.
How do you confuse the two? I mean,
No,
Matebula is a
Honorable
female.
member, Honorable
Chabangu is a
member.
male.
Honorable member, can you take your seat, please? You may continue.
Honorable Chair of the session, Honorable Minister of Health, Dr. Aaron Motsoaledi, Deputy Minister of Health, Dr. Joe Pasla, ministers and deputy ministers who may be here, colleagues, MECs, the chairperson of the Portfolio Committee of Health, Honorable Dunjwa, honorable members of the House, distinguished guests, ladies and gentlemen. I'm greatly privileged to be part of this National Council of Provinces Health Budget debate, as indeed the Constitution determines health as a concurrent national and provincial function. The experience that we have gained over the past 23 years of attempts to integrate and to strengthen the public health system makes it vividly clear to us that without a mandatory universal health coverage system, the many good efforts that our members have so aptly presented here and in the past, and the progress that we have made may not necessarily be sustainable. However, Speaker, it is also important that we acknowledge that the Minister's main focus over the past months has been on making sure that the white paper on the national health insurance addresses this matter. And it is that in that context that I hope that the EFF will change its mind and support this budget, because it is indeed geared towards having more equitable health system in our country. Greater agency and resolve to implement the NHI will not only enable us to achieve the NDP goals, but also contribute to a more humane and equitable health system in the world we live in through the United Nations Sustainable Development Goals that we are signatories to. We welcome the Minister's pronouncement in this regard of fast-tracking the NHI white paper and commit to ensure that Gauteng makes its contribution. Amongst the progress we will be building on in terms of ushering the national health insurance system is the strengthening of primary health care, where 196 clinics out of 369 attained the ideal clinic status since inception. Our target for 2017-18 is to have 240 of these clinics achieving the ideal clinic status. We must improve quality so that our people can indeed have access to affordable quality care through a reliable primary healthcare system. I'm also pleased that despite all the many problems we have, including the Life Esidimeni tragedy, the Gauteng Department of Health obtained the highest average score on ideal clinics for 2016 at 78% against the national average of 69%. We fully agree with the Minister and have spared no effort in ensuring that all those cited in the Health Ombuds report on the tragedy of the Gauteng Mental Health Marathon Project are held accountable. And as a department, we are going even further to try and understand the underlying factors as well as the risk factors, so that we can truly say never again. We are very encouraged, Chair, by the progress that has been made in relocating patients from the unsafe NGOs to safer facilities. And this is also one area where partnership with the private sector can help us achieve more equity and quality care. We will continue appraising the families that have worked very closely with us in this regard, including to consider positively one of the recommendations they made, that in these facilities that have involuntary and assisted mental health patients, family committees are critical. We will implement this matter in the next, within this financial year. One of the two underlying factors is indeed the burden of disease that we are facing, and secondly, the financial pressures that the public sector and system suffers from, despite the reasonable 8.5% of GDP of the country being spent on health. It is important that we fast-track initiatives to ensure an integrated health system. As Gauteng, we support the health budget as it will facilitate various health promotion and disease prevention strategies, including in mental health, maternal and child health, HIV, AIDS, and TB, as well as screening of various non-communicable diseases. In our attempt to optimally utilize resources available in the totality of the health system, we are participating in the contracting of general practitioners in clinics, and also contracting general practitioners in services like medical male circumcision. We are also serving many patients that are on medical aids, as many of them, by the end of a year, their benefits are exhausted, or even they are referred by their private doctors to even higher quality of care in the public sector. The complexity and the fragility of the financing of the public health system dictates that any attempt to effect efficiencies need professional and expert support with optimal involvement of patients and their families so that patient safety is not compromised. Further, there's also a need to strengthen the public health approach and stakeholder involvement in disease prevention, health promotion, and overall reduction of the burden of disease, because this is a burden not only on people as individuals, but also on the economy and the society at large. It is in this regard that we will be instituting awards for health promoting municipal wards in our province so that communities participate in lifestyle changes to reduce that burden of disease and to take control of their own health, and as well as going early after screening for health services, for diseases. In view of all these challenges, but also possibilities, the department is also strengthening frontline services. Currently, we see over 22 million patients in our EMS, emergency medical services, primary healthcare facilities, as well as in hospitals. In this regard, we will be strengthening the clinic committee's involvement. We have agreed that we will be meeting on a quarterly basis with all the clinic committees, and also similarly with the hospital boards. We are encouraging the ownership of the Gauteng health services by the people themselves. We will also be mitigating the financial risks that are there, and we look forward to, Minister, with your leadership, to legislation that will help in reducing the risk of litigation against in the health sector. This litigation will assist not only the public health system, but also to ensure that doctors, especially obstetricians and those in the surgical specialties, stay in the health system. It is important that whilst we look at the issue of improving patient safety, we also mitigate against the risk of medical legal litigation. We look forward to this legislation, and in the meantime, we have instituted a mediation process in a bid to minimize escalating costs. The department has managed to save over 61 million rands to date from 18 cases that were referred to a team of lawyers and medical specialists, amongst others, also in that team being the retired Judge Klassen. We have completed, in terms of infrastructure that is of quality, a number of construction and revitalization projects in the first financial year. And with the additional national infrastructure grant that is part of this budget being debated today, we will be building new facilities as well. We'll also fast track the renovation of the psychiatric wards in Helen Joseph Hospital and Charlotte Maxeke Hospital, as well as the forensic pathology facilities. I also need to take an opportunity here to indicate that we have quite advanced in negotiating with the officers that support forensic pathology, doctors, to mitigate against the continued pain and discomforts that are brought by the work to rule by the officers at our various forensic pathology facilities. And I can assure the public that with the support of the military health services, we will be restoring these facilities to the public. With these few words, and committing also to open primary healthcare facilities, in addition to the rent gate that we've opened early this year, Soshanguve Block JJ Clinic, which was built by the municipality, has also begun services, and many others. We believe that supporting the budget as presented by the minister will help us build on the progress we've made and work quicker towards a universal health coverage. I thank you.
Thank you very much, MEC. I just thought that I should bring it to the attention of the House. If you listen to the MEC, the last part of it, the current challenge that the province is faced with, there was a special request that she be excused immediately after presenting her input, for which we have agreed, so that it shouldn't appear as if she's not interested in the debate. She was just interested in us listening to her, and she's not interested in listening to the others. So you are excused, ma'am. But thank you very much for your commitment against all the challenges that you are going through in the province, but still found it necessary to come to the House. Thanks for that commitment. Thank you very much. Can I therefore call on MEC Dloma, KZN?
Honorable Deputy Chair, honorable members of this House, Minister Mtswaledi, Deputy Minister Pasha, my colleague MECs from various provinces, we take to this House to actually give our thanks and respect to the Minister and also support his commitment and the budget that is just tabled. Indeed, he actually points out recently that this year we are at the end of our 5 years, which is regarded as a preparatory phase of the National Health Insurance. Now, the Minister has actually given an extensive account of the NHI. For me here is just to mention that we are very humbled that we have 3 districts in the province that are actually piloting NHI, and I will point to what actually is the outcome of the process. Because if you look for an NHI, you will not find a bullet called NHI. You will see steps of preparation of our country and the health system towards that. And those are some of the issues that I'm going to raise. One, we have currently what we call family health teams. Nurses, healthcare workers who are going to families to establish and check the health status of each and every family. 136 of those have been established and therefore leading community caregivers. Number 2, we have what we call school health teams, Honorable Shabangu. School health teams, we have 209 of those already established in the province. Also, the leader of those teams is a professional nurse supported by enrolled nurses and nursing assistants with community caregivers. They visit schools to screen learners for barriers to learning, visuals, hearing, psychosocial, and other physical barriers, just to name a few. Just in this last financial year, we're able to access over 3,000 schools, screening a total of 143,000 776 learners from grade R to grade 10. One of the other things that also makes us to be able to do this is also through what we call Operation Sukumasake. You will not believe that we are now able to actually identify malnutrition, but very early when we visit schools, and therefore package this as part of our program on what we call a poverty alleviation program in the province, so that we could then focus on them. Mama Honorable Zwane was talking about getting GPs. We have 90 contracted GPs now who go to clinics and work there and actually help some of the patients to bypass a district hospital, because these doctors are able even to see patients there, order x-rays in the hospitals, and therefore see patients and even take it from the clinic straight into a regional hospital because of their work that they've already done. We have, through the Ideal Clinic Realization and Maintenance Program in the province, have 80 facilities that have been accredited as ideal clinics. Means these are clinics people don't call government clinic, they call it our clinic, that opens at the time that we love, and sees all patients and not close until patients have all been seen. We are very happy that this is pioneered in the whole country, the e-primary healthcare strategy, where in the pilot size, NHI pilot size, we have initiated the health patient registration team, registration system. It is important, however, to say, as we are saying, these are steps you to build in. In the facilities that are under NHI, we have actually improved through revitalization and improvement of them. 120 million has been revamped, and Fort Napier just next to it, 116 million has been used for that. For this to be successful, we continue having to hire engineers and people who can maintain, because this was the vision of the minister. You cannot actually revamp your hospitals and clinics unless and until you have your own engineers in there. We do have. One of the successful stories that was initiated by National Department of Health was this program called Central Chronic Medication Dispensing and Distribution Initiative, where patients do not have to come to our facilities now every month. Once in 4 months' time they come, and the rest we give medication to them. And we actually have found that in the province, in KwaZulu-Natal, we have 576,000 patients that are already on this program, and saves them money. They are decongesting our facilities. The waiting times and the queues are no more than our clinics, because we are able to serve and give them. Now, Chairperson, being the year of President O.R. Tambo, I'm reminded of what he said at the International Conference on Children's Repression and the Law of Apartheid South Africa in 1987, and I quote, "We cannot be true liberators unless the liberation we will achieve guarantees all children the rights to life, health, happiness, and free development, respecting their individuality, inclinations, and capabilities of each child." Inspired by the minister, we therefore started a program in the province of Human Milk Bank, where we actually ask mothers who have enough milk to really spare us that milk so that we can give to children or neonates whose mothers have either passed on or are not able to breastfeed. This we were following because it is this country that declared that from August 2011, the minister said South Africa is declaring it as a breastfeeding country. Now, we currently have to date 13 functional human milk banks in 9 of our 11 districts. This, we have received donations from 570 mothers and dispensing pasteurized donated human milk to 887 infants, pasteurizing 606,000 donor milk. So we are really going out there asking mothers to donate milk because it gives life to other children. At the community level, we have established a program called Pilamtwana Centers. And again, supported by OSS, Operation Sukumasake, we are able to go early enough to communities and identify children that may either be malnourished or actually having other challenges. And through this, Honorable Minister, we are now able to record that we have noticed a noticeable decrease of child under 5 mortality. Maybe still early to record, but we've seen this figure coming up. We also have said we must go back to basics in establishing mothers' lodges, and that we actually are doing in great numbers.
We actually have, after the World AIDS Conference, thanked our nurses who actually, 3,500 of them, who actually produced a book writing about their experiences of how it was to diagnose, treat, and manage patients on HIV. And those are we have now 1.1 million in the province who are on ARVs. Chairperson, we want to actually indicate that we started a campaign of going around and forcing those people we call health murderers, people who are actually putting stickers, safe abortion, quick abortion, and remove those stickers to actually then request our members of the society, if they need to terminate pregnancy, to come to our facilities. It's probably still early to notice, but I've just checked the Durban hospitals. We have seen a decreased number of septic abortions in hospitals, meaning that women still do have miscarriages, but they do not have the septic ones, meaning that they probably don't go to those areas. Honorable Chairperson, I want to end by in the two issues that the medical legal litigation process is actually being focused on. We have established a unit that is focusing on these processes, and it is composed of medical practitioners, legal experts, and other administrative staff. With a few seconds remaining, Honorable Chair, I'm sure you'll do the same to me when I finish with my budget, not because I do not like. There's a challenge that we are facing in the province that I'm supposed to actually be part of. We have recorded in Nkosi Albert Luthuli a departure of the last two oncologists, and therefore a service that is supposed to be happening is now having challenges. But however, we have got a very short-term plan where we have put the doctors who are oncologists at the Grace Hospital in Pietermaritzburg to come and support us at Nkosi Albert Luthuli on certain hours, on certain days. Because we do have also doctors there, it's just that you need to have a team leader who's called an oncologist. Number two, we have also had a discussion with the 4 oncologists who are on private practice called Rainbow Oncologists, who have agreed to actually come in. They already are working with us. They will extend their hours supporting us on obstetrics and gynecology clinics on Tuesdays and Thursdays. Number 3, there is a team of 25 oncologists under the name Hopelands Oncologists who are going to be sitting outside where they are working. They are going to deal with us an issue they call off-site planning how to actually manage patients. It is very possible if you link that with them through a sort of a support of lines. The fifth one is that we are waiting for a clearance of a foreigner who has actually sent his foreign national who has actually applied to be who's an oncologist who wants to come and get a job. We are ready to employ. But a full service, Honorable Chair, will come when we actually could get a sizable number of resident oncologists in that hospital. So with those comments, Honorable Chairperson, I should have asked you before I started that you'll also allow me to leave somewhere before so that I could be in that province to manage, among other things, these challenges that we face on the oncology. Thank you very much.
Thank you very much. You see, the only difference between MEC Dlomo and Ramokgo is that hers is on record. There's a letter that has been written. It's okay then. Deputy Minister, Pasha, can you continue the debate as I welcome you as well? Oh, Kaula, sorry. No, I marked you even before I called you, so it should have been. Honorable Kaula.
Honorable Chairperson, Honorable Minister, Honorable Deputy Minister, the public health sector is seriously challenged by infrastructural, organizational, and staffing shortfalls. The NCOP has just returned from the Taking Parliament to the People preliminary visits in the Free State Province. In almost all the clinics and health centers visited, the biggest challenge was staffing shortages and non-availability or dysfunctionality of equipment. This crisis is largely a result of the toxic mix of corruption and incompetence in government. Whether one blames this on the legacy of apartheid or the last 23 years of ineffective leadership depends on one's political lens. Of late, the KZN health system is fast collapsing under the watch of the present administration. Most public hospitals, community health centers, and clinics in the province have a shortage of equipment and medication. There is a critical shortage of doctors and other healthcare professionals. There is a raging poor treatment of overworked specialists. The symptoms are numerous and the diagnosis is unmistakable. The recent march by Sama Hospesa and Denosa in KZN has brought this matter to levels of desperation. There was a time when KZN public hospitals were considered the best run in the country. This mainly applied to former missionary hospitals, which nowadays stand in the shade of their former glory. Medical students from universities in RSA and abroad flocked to these hospitals for the clinical electives. The hospitals were clean and exceptionally well managed and were particularly well known for upholding the Batupele principles. The whole host of government neglect, poor management, chronic over-expenditure, bad decisions, and wastefulness have deteriorated those conditions. The Honorable Dr. Mtswaledi scored points with many South Africans when he admitted in Parliament in 2009 that the medical profession was underpaid. He stated that, and I quote, "I would do everything to make sure that our medical doctors and other health professionals are happy and remain in the system. I want as many matrics as possible to want to study medicine. I want to increase the intake of doctors 3- or 4-fold, unquote. It's hard to believe that 8 years later, there are community service doctors and other doctors who heeded the Honorable Minister's call to study medicine, but they are sitting at home unemployed. Many doctors and specialists are leaving the healthcare public service because of the rigid manner in which the department has handled the remunerative work outside public service. As a result, in KZN alone, only 2 oncology specialists are left to attend to thousands of cancer patients, Dr. Long. I have always raised a concern on behalf of the IFP that what the Honorable Minister projects does not resonate to what practically takes place down in the provinces. The Minister himself has admitted that he is hamstrung with the system that allows provinces to do as they please, resulting in dysfunctional health institutions. We have recently witnessed a tragic drama unfolding in the Gauteng province, in which more than 100 psychiatric patients died needlessly due to neglect and lack of appropriate health care. This was largely a result of administrative incompetence and political arrogance of note within the provincial government. The Gauteng crisis is not an isolated incident. It is symptomatic of a crumbling public health system nationwide. The tale of mismanagement and human rights abuses of the most vulnerable patients who are both sick and poor echoes across the length and breadth of our country. We read of Section 27 report entitled Death and Dying in the Eastern Cape, which makes for horrifying reading. It contains the personal first-hand accounts of patients with blood-curdling in hospital experiences. Section 27's executive report summarizes this situation as follows, quote, "We are no longer dealing with the legacy of apartheid, but we are dealing with the failure of our democracy," unquote. Greg Nicholson wrote, thanks, Chair. Greg Nicholson wrote in the Daily Maverick on 24 January that the Eastern Cape health system has collapsed, it is riddled with corruption, there is no electricity or water, no drugs, too few doctors and nurses, no chance of ambulances arriving, no dignity, no care, unquote. This begs the question as to who is ultimately responsible for this state of affairs. I thank you, Chair.
Thank you very much. I therefore call on the Deputy Minister Phahla, as I welcome you.
Thank you very much, Honorable Chairperson, Honorable Minister of Health, Dr. Aaron Mtswaledi, Honorable Ministers and Deputy Ministers present, colleagues, MECs, MEC of Limpopo, KZN, Gauteng in absentia, and MEC for Eastern Cape, the Honorable Chairperson of the Select Committee on Social Services, Honorable Dlamini, Honorable members of the Select Committee and all honorable members of the NCOP, distinguished guests, Dumelang Bagaishu. Ladies and gentlemen, I want to thank the Chair for this opportunity to participate in this budget vote of our department. And I wish to do so also joining my comrades in the ANC in dedicating this to the memory of our leader and icon, President Oliver Reginald Tambo, an exemplary leader who gave all his life to the liberation of South Africa from the bondage of apartheid. In the memory of O.R. Tambo, we must work hard to realize the vision of a long and healthy life for all South Africans through the realization of the universal health coverage, through the implementation of the NHI. Honorable Chairperson and honorable members, non-communicable disease continue to rank very high in causes of death, as indicated in the 2015 State South Africa report. Diabetes mellitus has moved from third cause of death in 2014 to a second highest cause of death in 2015. Diseases of the circulatory system contributed just over 17%, those of respiratory system just under 10%, and neoplasms just around 9%, and also metabolic diseases just under 7%. The latest National Cancer Registry reports that the top 5 cancers in men are the CA of the prostate, carcinoma of the skin, colorectal CA of the lung, and also Kaposi sarcoma. In women, the top 5 cancers are CA of the breast, CA of the cervix, CA of the skin also, colorectal CA, and also CA of the uterus. Our strategic plan for prevention and control of NCDs 2013 to 2017 is coming to an end, and we are now in the process of evaluating the impact so that we can finalize the new strategy to be launched in the coming year. We need to improve our capacity also working with non-governmental organizations and private sector participants in order to, amongst others, increase awareness and measures to prevent diseases, increase access to screening opportunities for early detection of disease, maximize access to effective and affordable treatment, including reducing the cost of some of the life-saving cancer medications. And in this regard, we welcome the work initiated by the Competition Commission in terms of investigating a number of pharmaceutical companies with a view towards reducing the high cost of these medicines. South Africa's performance on implementing the HPV vaccine remains one of the best practices globally. The vaccination of approximately 1 million young girls against cervical cancer is an exceptional life-saving achievement. We are looking forward to the implementation of the tax on sugar-sweetened beverages as initiated by the National Treasury, which will help reduce the high levels of sugar consumption. We are in the process also of amending the Tobacco Products Act and also a proposed new tobacco bill, which will strengthen regulations for higher measures for creation of 100% smoke-free public indoor spaces. This will also lead to the introduction of standardized plain packaging of tobacco products, and also to cover electronic nicotine and non-nicotine delivery systems. In the area of palliative care, Honorable Chair and members, we are pleased that we have joined only a handful of countries in adopting a national policy, framework, and strategy on palliative care, which is based on the WHA resolution. This creates an enabling environment for the care of patients and families facing life-threatening diseases, improving quality of life while maintaining dignity from diagnosis of catastrophic diseases up to death. The implementation of the policy will be overseen by our colleague, the MEC for KwaZulu-Natal, Honorable Lomo, who's not only just the political head in that province, but also an expert in the area of palliative care. In the area of malaria, Honorable Chairperson, our department set a target of 0.2 malaria cases per 1,000 population in the risk areas. This has largely been achieved in the 3 provinces which are affected by malaria, except in the province of Limpopo, where this target was missed. And this can be attributed to the weather conditions, where a good rainfall, while good for the agriculture, is also means that there's more mosquitoes and more malaria transmission. But on the other hand, a lot of work is being done between ourselves in the national level of sphere of government, together with the provinces, in making sure that we can improve case management of malaria and also improve on indoor residual spraying. But also we can mention that we've got good cooperation in the region, in the SADC region, as part of the Elimination Aid Initiative, which involve countries such as Angola, Botswana, Namibia, Mozambique, where we are collaborating in as far as the elimination of malaria. We can also report that just on the eastern side, between KZN and Swaziland, the good cooperation there has seen a real dramatic reduction in the transmission of malaria in northern KwaZulu-Natal. Honorable Chairperson, among some of the entities which we oversee is the South African Medical Research Council, which continues to do very sterling work in the areas of research in collaboration with a number of international agencies, including the Bill and Melinda Gates Foundation, including also the Newton Foundation, the British Medical Research Council, GlaxoSmithKline, and also the Canadian Institute of Research. Our National Health Laboratory Service continue to be a flagship in providing laboratory services in the public sector. Notwithstanding a number of challenges, the NHLS continue to provide valuable service to all our hospitals and clinics, and we are in the process of also piloting a bill which will have a major impact in as far as improving governance in this institution, but also making streamlining of the functions and also making sure that we can provide affordable services. In the area of emergency medical services, a lot of work has been done with new regulations which will streamline our ability to provide services, also being conscious of the fact that trauma is one of our major challenges. We also have adopted a number of strategies in terms of improving the quality of training. Lastly, Honorable Chair, just to mention that our Fidel Castro Nelson Mandela collaboration, where we are training a number of medical students in Cuba, also continue to contribute to our our health human resources. At the present moment, we have just under 3,000 students in Cuba, about 70 of them in the final year, and in the coming year, 2018, we will be receiving just under 900 final year students who will come and do their final year, which will be the highest number of such final year students coming on to do their final year. And we believe that this will have a major impact in as far as making sure that we have many more doctors in our public service. I want to end by urging members to support our budget vote, because indeed it will go a long way in making sure that our people have long and healthy life. I thank you, Honorable Chair.
Thank you very much, Deputy Minister. Can I then call on Honorable Ngobeni? I am presiding.
Thank you, Honorable Chair, Honorable Minister, Deputy Minister, Honorable Chairperson of the Select Committee, Honorable members, and our guest, good afternoon. One of the founding missions of the ANC is enshrined in the Freedom Charter, which talks about equal rights for all national groups and free medical care and hospitalization. It is for that reason that the ANC, in its policy discussion and resolutions, the provisions of the Freedom Charter always finds translation in government. Our goals has always been about serving our people and putting people's needs first. The Freedom Charter has been rubber-stamped by the Bill of Rights in our Constitution, a special section 27, which states that health care is a right. We continue to build health infrastructure, state-of-the-art hospitals. I can cite an example, Chairperson Hospital like Mapulaneng, Mamitlake, Middelburg, and Kwamtlang. That is the hospital that are going to be built in this financial year, although it's a multi-year project. Let me indicate that through this department, I think we have achieved a lot. And also, our commitment in improving our health system is our main priority, and it is confirmed by our bilateral agreement with countries like Russia, and Cuba, where we have sent our students to study medicine, as the Deputy Minister has highlighted. Most of the critical issue outlined in the budget speech of Minister Motsoaledi confirms the ANC's policy direction and are in line with the resolution aimed at improving our healthcare system. The National Health Insurance, as an example, and it is in its preparatory phase or stage. We have indeed made huge progress in health, as Minister Motsoaledi stated that even the Statistician General has agreed in his results of the South African Demographic and Health Survey. Let me indicate, Honorable Chairperson, that since it's the year that we are celebrating 100th birthday of its longest serving president, the late O.R. Tambo, and we have declared this year the year of O.R. Tambo, the year of unity. O.R. Tambo always wanted a united South Africa, and this was evident when he, in one of his speeches, said, I open quote, the ANC is a national movement. We all communists and non-communists, unlike want a non-racial, democratic, and united South Africa, close quote. We want our ANC-led government to fulfill the vision of O.R. Tambo as he dedicated his entire life to the creation of democratic, non-racial, non-sexist, and prosperous South Africa, where all people, regardless of their economic or social status, would have equal rights. Chairperson, ni pfumeleli ku vula leswaku loko hi langutisa infection or the new infection in HIV yi decreasile. Why? Because of the drugs that people are receiving. Hi lava ku vula ku government le ile ku tirheni siyachuba siyasebenza siyachuba. Se ni la ku vula futhi xin'wana Chairperson ku the province of Mpumalanga had the outbreak of malaria. La hi nga vona department yi kota ku pfuna vanhu. We haven't experienced many deaths because they were assisted or they were healed for this malaria. So it rhandza ku commend the Department of Health ka sweswo. Ni pfumeleli futhi Chairperson ni vula leswaku tanihi government loyi a nga ku leadeni la Mpumalanga as a rural province, problem leyi nga na yo or the challenge is that mapatu ya hina ya ku tala they are not in good state just because the ambulance ta hina loko va xava a ti hlweli ku hatla ta ku tala ta ko ti onhaka because loko ku ri a rural province ku na ti-challenges ta ku tala ngopfu. So therefore hi la hi nga na nkinga ngopfungopfu koho. But we want to say that on this NH high hi langutise yini? Hi langutise eGersibande district la yi pilotiwaka kona. We have seen one of the clinic when doing our oversight. Lai, we were very much happy as the portfolio committee because hi vone ku this ideal clinic, indeed, they are not standing or sitting there for long hours or long queues because va kota ku endla yini, va kota ku hatla va pfuneka eka ku kuma ti-file ta vona, eka ku kuma medication ya vona, a va teki nkarhi wa ku leha. So hi la ku hlamusela ku loko hi karhi hi ri koho we encouraging people ku va sungula va ya etitliliniki before going to the hospitals because hi leswi endlaka ku va na ti-queues ta ku leha a swibedhlele handle ka ku munhu a ye tliliniki hikuva nga kota ku pfuneka, they can receive their medication, those who are chronic lava nga ti-chronic patient va nga kota ku hatla va pfuneka kokwalaho va kuma maphilisi ya vona va famba. So hi lava ku vula ku as a Department of Health hi lava ku yi ndhundhuzela kumbe hi lava ku khensa swinene because they are doing very well. But ni pfumeleli Chairperson ku ti-challenge ti ta tshama ti va koho. La ku nga na vanhu ku tshama ku ri na ti-challenge se sweswo hi nge swi balekeli whether hi win government loyi a fumaka, ti-challenge ta tshama ti ri koho mara hi lava ku vula ku hi nge swi koti hinkwaswo 100% ka ha ri xinkarhana 23 years. Loko vo va ri ta fa u ri na 23 years I believe ku nga rila ngopfu because malembe lamatsongo. So we want to indicate that as the committee we support the budget leyi ya 42 billion ya Minister Motsoaledi na cancer. Thank you very much.
Thank you very much. Now I call on MC Ramathuba to continue the debate.
Honorable Deputy Chairperson, Honorable Minister of Health, Honorable Deputy Minister, colleagues, MEC Eastern Cape, MEC Gauteng, MEC KZN, honorable members of the House, distinguished guests, ladies and gentlemen, Dimasiari, Inhlekani, Tovela, Goeiemiddag, good afternoon. Today, Honorable Chairperson marks the 89th anniversary to the Argentinian-born commander, a Cuban revolutionarist, Dr. Ernesto Che Guevara, who was spot on when he said, for one to be a revolutionary doctor or to be a revolutionary at all, there must be first a revolution, close quote. Our health
Honorable
systems...
MEC, can you just take a seat? There's a point there.
Thank you very much, Chairperson. Modula Stilo, ke kopa gore o re tseye ka go lekalekana ka gore ha e sale go tloga maabane ke go tsibusa ka kgang eo tsamaisang ntlo ka yone ka mokgwa o tsamaisang ntlo ka gone honorable wana hela ha tsoga mo borokong wa go and wa rasa na ebile ke a tshoga ka gore ke reditse speaker mo podiumeng ke batla go tsamaisana le tsela e speaker se tsamayang ka yone mo podiumeng. Honorable wana ke go pora hala ha tsoga mo borokong a phaphamele ko ntle a tlogela
Okay, I've heard you.
because ke itse gore ha ene le mongwe wa leloko la EFF a dira a itshwara ka maitshwaro awa o ka be le kgale mo lelekile kgotsa o mmiditse ka leina mo go wa mo tegantlo. Ke a
Okay,
leboga,
fine,
Modula Stilo.
fine. You see, honorable members, the problem is that when we started the session, Honorable Kony was not in the house. And I made a few comments, and I spoke to sections 30, 35, and 37 of the rules of proceedings and the rules of debate. Unfortunately, she was not in the house. She might have a point to say, Honorable Wana, to heckle is not a problem, but she gets scared. You are scaring her. Hey, you can heckle and get excited, but all right, thank you very much. Honorable, let me see, you can continue the debate.
Dr. Ernesto Che Guevara was spot on when he said, open quote, for one to be a revolutionary doctor or to be a revolutionary at all, there must be first be a revolution, close quote. Our healthcare system, Chairperson, requires men and women, especially healthcare professionals, to be revolutionaries, for them to be able to transform the healthcare system in order for it to serve the masses of our people. These revolutionaries, as per Comrade Chair, will not exist until the healthcare system itself becomes a revolution. Hence, the ANC-led government has adopted, and the Minister of Health is at pains to continue to, as he tries to pursue amongst us to begin to appreciate and welcome and rally behind the National Health Insurance. The National Health Insurance is the only tool towards the revolution of our healthcare system. Hence, we don't have an option but to support the minister in his call to support the National Health Insurance. Limpopo Province Chairperson is hard at work to prepare our public healthcare system to be ready for the National Health Insurance, including infrastructure overhauling, the 57 ideal clinics that have been accredited now, the 37 GPs that have been contracted in our facilities, the building of the academic hospital, and the Limpopo Medical School as pronounced by the former Minister of Finance, Pravin Gordhan, the 239 out of the 444 clinics that are currently providing 24-hour services, whether on call or full-time. The province is facing challenges as a result of quadruple burden of disease. This has contributed negatively towards our hope and dream of a long and healthy life for the people of Limpopo. Chairperson, we are beginning to see a reduction of burden of disease as a result of HIV and AIDS. Hospitalization, mortality rate, and new infection have gone down. Over 1.5 million people were tested against our annual target of 1.4 million people just in third quarter. After battling for 4 years, Limpopo Province has finally managed to reduce vertical transmission of HIV from mother to child from 2% to 1.1% against the target of 1.4%. This has also translated into reduction of infant and under 5 mortality. Indeed, our HIV-free generation, it's possible. These success stories are attributed to, amongst others, adopting and implementation of our HIV strategies, the test and treat policy, the training of 200 nurses on nurse-initiated management of antiretroviral therapy, adopting of the CCMDD where 83,401 patients are already on this program has resulted in us having to start 52,256 new HIV positive clients on treatment, bringing the total of more than 300,000 people in our province to be on ARVs and living a long and healthy life. These people and these patients would ordinarily could have been dead now if it was not for this program. Chairperson, the department has adopted the recently launched She Conquers campaign, which is aimed to motivate the young girls to remain in school, contain their edge for unsafe sex practices with unworthy men, and pursue careers which are in line with their skills. We visited all our TVET colleges. During our interaction with some of them, they challenged us to stop calling these men blessers. Their understanding is that a blesser is someone who cares, who loves, and who protects. They know that God is their blesser, and they were asking me that someone who makes them fall pregnant, infect them with HIV and STIs, including HIV and AIDS, leaving them vulnerable and destroy their future. How can we refer to that person as a blesser? Why don't we simply call them sharks? Chairperson, despite our treatment success rate of 84.7%, the number one cause in terms of TB, the number one cause of death still remains TBs. During 2017-18 financial year, the department will be implementing the 9-month short course regimen of TB. Chairperson, while we have noted the reduction of institutional maternal mortality from 167 per 100,000 delivery to 159 per 100,000 delivery, which is attributed to improved antenatal care before 20 weeks and the introduction of 20 obstetric ambulances dedicated to transport pregnant women, only the training of 2,939 healthcare practitioners on SMOE, we are still concerned about the death of a woman trying to bring life. We see this as a serious contradiction. Hence our stance, no woman should die while giving birth remains. We'll continue to reinforce accountability amongst managers and healthcare workers so that not even a single woman die because of giving birth. We strongly believe that we do not actually need the state-of-art equipment or state-of-art facility to deal with. But however, on top of the list, we need the state-of-art attitude amongst our employees, from the men at the gate to the HOD and the MEC. Chairperson, Vembe and Mupani district are traditionally known to be malaria endemic areas. Malaria is a seasonal condition starting from September to May. Hence, we start with our indoor residual spraying from September annually. Cases generally decrease towards the end of April. During the 16-17 financial period, malaria remained at low levels. However, with more than normal rainfalls during the summer and reported outbreaks in our SADC countries, Zimbabwe, Botswana, Namibia, Mozambique, Limpopo then became a malaria casualty. The major challenge for this year as compared to other years is experiencing malaria in districts like Waterberg, which historically has never been a malaria endemic area. Of course, this is attributed to the outbreak in Botswana, which shares the border with Waterberg district. Secondly, instead of having malaria cases declining during the end of April, it peaked where in the last week of April, we saw 1,232 cases from 100 to 150 since January. Adding to the upsurge of the lack of Coartem oral tablet to treat malaria at primary health care
in the country has left us with no option but to centralize treatment of malaria at the hospital, where intravenous medication could be used even for non-complicated cases. That is why honorable members have seen or saw overcrowding in our hospital until the 2nd of May when we receive medication. Malaria today is under control. Last week we only had 5 cases in the province. As such, there is no need for alarm. Chairperson, professionalization of the human resource in health is critical to us. Not everyone can cook patient food. That is why we are left with 7 hospitals to finalize our insourcing of the kitchen. We have since signed a memorandum of understanding with our Limpopo TVET colleges so that we can provide learners with 18 months experiential learning platform, which most of the time they fail to graduate due to lack of thereof. These learners include food service aid, whom upon completion will be appointed to provide nutritious, balanced diet for our patient, since it is their specialty. Hence, we say we must professionalize human resources for health. Our engineering students, mainly artisan, including plumbers, electrician, carpentry, electromechanical, will not only get platform to study in our facility, but however, they will be providing maintenance to our dilapidated facility. This will go a long way in skills development for the country and also empowering the young people so that they can graduate and join the employed community as we strengthen our reduction of unemployment, inequality, and poverty. Chairperson, we are a Department of Health, not the Department of Disease. We want you healthy. You are a doctor to your life before any other doctor. So it is critical for everyone in this house to live a healthy life, exercise regularly, eat healthy, stop smoking, stop drinking, or reduce alcohol intake. Know your health status by regular blood pressure check, cholesterol and sugar checkups, including HIV and AIDS. Your health is your responsibility. Rihanyo ra n'wina I vutihlamuleri bya n'wina. Maphelo a lena ke maikarabelo a lena. Mutakalo wa bo ndi vutiphinduleli habo. Your gesondheid as jou verantwoordelijkheid, not that of Minister of Health, Dr. Aren Motsoaledi. On that note, as Limpopo, we do support this budget, which is poor, and working class. Thank you.
No, thank you very much, MEC. Honorable, you know, I don't want to do the same mistake because I can't see Honorable Samka. You see now. I'm looking at her from the Eastern Cape side. Okay. Honorable Samka, can you continue?
Nkosi Sihlalo. Ndivumele ndithi ingqanga nentsiba zayo. Phambi koba ndingene kwintetho yam Sihlalo, khawundivumele khe ndihambe nomrhiba. Sihlalo, kuyinene into kokuba namhlanje sibe sithetha ngokokuba siqhamla iziqhamo zenkululeko. Loo nto ibonakala Sihlalo kule ndlu. Okwesibini Sihlalo, kuyabonakala into kokuba singurhulumente wobambiswano wentatho nxaxheba kawonke-wonke. Iboneke kule ndawo yokokuba kubekho amalunga azawuma kule podium athi le budget akayipasisi, iba nomfanekiso-ngqondweni, picture yengqondo. Xa le budget yezempilo singena kuyipasisa siyile ndlu, kungenzeka ntoni kweli lizwe? Ithini ngathi loo nto thina abantu bamela abantu apha eMzantsi Afrika kule parliament sisuka kula maphondo? Xa singazuyipasisa ibudget, iba nomfanekiso-ngqondweni Sihlalo. Mandidlule ke apho. Sihlalo, kule minyaka engama-23 urhulumente weli sele ehambe umgama omde ukuqinisekisa ukuswa kweenkonzo kubantu beli lizwe, ngakumbi kwicala lezempilo. Umakulingane kunye nomgaqo-nkqubo sele wenziwe, ezinye zemiphumela yoko yaba kukumiliselwa kwe-RDP. Icandelo lokubelekisa nokunika ingqwalasela kwintsana iye yabonakalisa impumelelo ekwehliseni izinga lamanani okusweleka kwazo. Mininzi imithetho eyaphunyezwa, utshintsho kwimigaqo-nkqubo kwakunye nokusiwa kweenkonzo kuluntu zezinye zezinto esizingca ngazo singurhulumente we-African National Congress. Kule minyaka nje imbalwa edlulileyo, urhulumente uthe wazisa nge-National Health Insurance. Konke oku kuzama ukuba bonke abemi beli lizwe bakwazi ukufikelela kwezempilo ezincomekayo benemali, bengenamali. I-National Health Insurance ijongene noxanduva lwezempilo kweli lizwe, iqinisekisa ukuba wonke ubani unesidima ngenxa yeziqhamo eziyimiphumela nezincomekayo zale National Health Insurance. Mandinqinelane nomphathiswa weli sebe kwanomama umama uDyantyi, u-MEC welaphondo leMpuma Koloni kunye nomama uPhambo Sibhukwana. Sihlalo xa ndisithi i-OR Tambo nayo yeyaxhamla kula maphondo oluthoba, ibe yenye yendawo ethe yajongwa okokuba iqinisekise into yoba le NHI sithetha ngayo iyasebenza kakuhle. Sizingomba izifuba ke sisisizwe esintsundu, kuba nawe OR Tambo umncinanana nje kuthe kanti igalelo lakho libe nefuthe kutshintsho esilingqinayo. Ndithetha ke ngalangingqi, andithethi ngobawo uOliver Tambo. Xa ndisithi i-OR Tambo incinanana injalo, uyawabona umphathiswa into kokuba mayibe yezinye ezithi mazixhamle kule NHR ukwenzela into NHI ukuze kubonakala into yoba iyasebenza, abantu bayayithakazelela. Sihlalo masikhumbule ukuba iphondo leMpuma Kapa lelinye lamaphondo ebelisemva ingakumbi kwizakhiwo. Simele siyiqhwabele izandla into yokuba ndithetha nje umjanyana nenesinight le malungu epalamente ale komiti esulenkama sasiye kuyo ziphakathi kwezibhedlela ezizakuthi kwenziwe izilungiso kube nendawo ezakhiwayo njenge-OPD esasixelelwe ngayo xa sasiphaya. Isebe lezempilo ngokwe-ofisi yenkulu baphathiswa yephondo leMpuma Kapa ivule esona sibhedlela sikhulu ephondweni. Leyo yimpumelelo enkulu kubemi basemdantsane nendawo eziwungqongileyo kuba sikumgangatho wala maxesha sikuwo. Kwakhona isebe lezempilo eMpuma Koloni liza kuvula laye linikezele ngezi clinics zilandelayo. Ndicela ke ngokwabantu belaphondo baphulaphule kakuhle: iMaqhele, iMalephelephe, iLothana, Tikitiki, Enkanga, Kwenkwana, iSikhoba, Qebe, Falbank, Emahlubini, Zabasa, Centuli kunye neNgcizela. Ziiclinics ke ezo ezisezilalini. Siza kukhumbula sihlalo ukuba le komiti ibiselibode eSt Patrick's, apho namhlanje kuza kunikezelwa ngecandelo apho kwamkelwa izigulana, laa nto siyibiza ngokokuba yi-OPD ngolwimi lwasemzini. Kanti iFrontier Hospital kuza kunikezelwa nge-casualty kunye ne-OPD. Kungani singamqhwabeli izandla urhulumente okhokhelwe yi-African National Congress? Kuba xa sisiya kula maphondo sihlala, xa sisiya kula maphondo kwezona ndawo zifuna ukuncediswa kuba nemiphumela emihle. Kunjalo nje siyincomela ofisi kasihlalo osihlalo eMpuma Koloni kuba xa ikomiti isiya phaya bakhetha ezona ndawo zihlelelekileyo kuba befuna ukuncediswa, hayi into abakuyo kwindawo esezilungile. Loo nto yenza into yoba ke ngokumsebenzi ube lula kwelaa phondo nakumphathiswa kuba sizibonile ezi zinto okokuba zifuna ukulungiswa. Ukunqongophala koogqirha kweli phondo yenye yezinto ebezilucelomngeni. Kungoku nje yintetho yayizolo leyo. Iphondo leMpuma Kapa libekele bucala imali andikwazi kuyibiza ke iibhillions ezi-14.4 ukulungiselela ukuqasha oogqirha abanobuchwepheshe nabasebenzi i-general workers ukutsho oko. Isebe lezempilo kwelaa phondo lihambela phambili ekuqeqesheni oogqirha. Laa nto ke siyibiza ngoba zii-junior doctors. Amanani enyukile ukusuka ku-276 ukuya ku-348 kwakunye ne-medical interns. Loo nto iyakwenza ukuba eli phondo liphucule inani elivisayo loogqirha, ingakumbi abo baqeqeshwe eCuba. Kanti iSt Elizabeth elusikisi kapho ndisuka khona ixhamle koogqirha baseCuba, neSicilia Makhiwa neMdantsane kunye neSt Patrick's Elibode. Loo nto ibonakalisa into kokuba urhulumente we-African National Congress uyaphulaphula ngendlebe yaye wenza le nto ifunwa ngabantu kuba sikholwa loo nto thina bathini abantu sesenze oko. Olunye ucelomngeni eMzantsi Afrika kukunqongophala kwezithuthi zezigulana ingakumbi ezilalini. Iphondo leMpuma Kapa kwizicwangciso zalo malunga nesebe lezempilo lizibekele umgomo wokuba babe nee-ambulances eziluthoba ezizibhasi ezizawuthwala abantu abangama-25 nezitrecha apha ngaphakathi ezitandathu. Ingingqi nganye iyakufumana i-ambulance enye ngaphandle kwe-Sarah Baartman, yona iyakufumana iibhasi ezimbini ngenxa yobukhulu nokuqelelana kwayo. Njengelungu ke elimele iphondo leMpuma Kapa, ndiyakusoloko ndizixhasa naziphi na iinjongo zokuphucula ezempilo kweli phondo. Kungoko ndisithi siyi-African National Congress siyaluxhasa uhlahlo lwabiwo-mali lweli sebe lezempilo. Enkosi, ndiyabulela.
Thank you very much. Let's proceed. Honorable Kaila.
Thank you. Siyabulela mamusamka. Andizoyimoja. Ubeke kakuhle kakhulu. It is critical that health allocation to the province be increased in real terms and above inflation, so that we can show greater improvement in the delivery of public health services, in particular basic health. It is as is the case with the education system, we need a healthy nation in order to put South Africa to a sustainable socio-economic development path. A failing health system has devastating consequences for the current and many other generations to follow. Unfortunately, the 2017 budget does not respond to this challenge. The allocation towards provinces have been reduced in the real terms, despite them providing the bulk of public health service. The allocation should at all times match the rate of inflation or the rate of population growth per province and district. Another key challenge is the facility infrastructure through which public health is to be delivered. In many instances, they're not, and in particular in rural provinces like Eastern Cape, the infrastructure is in dire state with broken structures, inadequate ventilation, no access to water or electricity, waiting areas that do not accommodate everyone, and undignified or non-unworkable pollution facilities. In some countries where these facilities are located, there is a bigger challenge of socio-economic infrastructure that is relevant to attracting young, energetic medical practitioners, particularly doctors. Umzekelo sisibhedlele sase-Victoria eDikeni. One of the urgent interventions that are needed in this hospital relates to the supply of doctors. Due to the short supply, component by other objectives and subjective factors, you find doctors working both day and night shifts on the same day. This situation, if not attended to, can prove to be too costly for the provision of effective and efficient service and would compromise the whole government objective of responsiveness. Alice is largely, 70% of South African population, as confirmed by 2015 General Household Survey, use public health facilities. The majority of these are found in rural areas like Alice. It is therefore prudent for government to pay more attention and invest more resources to these areas in order to improve their conditions. Okokugqibela, mhlali wami endimthandayo, masiyithethe inyani sivume sibulele ubana phe OR Tambo eMSIdyantyi nifake emashini omonitorisha inhliziyo zabantu. Siyayibulela loo nto leyo, intle kakhulu. Okwesibini, ingaske siyaqonda ubana ibudget iyanibetha. Kubekho umashini ojongene nento zezinso. Baninzi abantu abafelekishayo ngoba bekho kwe-dialysis machine. Siyathemba ke ubana mphathiswa nobancedisa because ezazibhedlela zinabantu abaninzi abagulayo ubana noko nongeza lapha into esiyithayo makongezwe kule budget noko kuthengwe ezi equipment because izibhedlele ezisezilalini ezini. Siyabulela Maduna, ndiyabulela ubana uthethe kakuhle. Umuntu enesimilo ndiyamhlonipha, inkosi Maduna.
No, thank you very much. Honorable Botha, continue the debate.
Thank you, Chairperson. Chairperson, Ministers, Deputy Ministers, and honorable members of this House. Last week, we experienced one of the worst disasters this country has ever seen. I'd therefore like to extend my deepest and sincere condolences to all the family members who lost a loved one during the fires in the Southern Cape and during the storms across the Cape Metro. I'd also like to wish those who were injured during these tragic events a speedy recovery. As a province, we remain committed to working with anyone willing to assist in rebuilding the affected communities until their lives are restored and their dignity are restored. In the restoration of people's health, where this department plays such a critical role, because it's mostly those who have ailments that utilize health services. It is for this reason that our vision in the Western Cape is to ensure that all residents have access to person-centered quality care. Chairperson and honorable members, as a province, we have undertaken to provide equitable access to quality health services in partnership with relevant stakeholders within a balanced and well-managed health system to all our residents. We're highlighting the importance of providing these services in partnerships because we realize the only way we'd be able to provide a comprehensive, cost-effective package of health services is through working with relevant and interested parties. An example of interdepartmental cooperation is the first 1,000 Days Initiative, which was last year launched by the Western Cape Departments of Health and Social Development. The project forms part of the province's campaign to raise awareness of the crucial first 1,000 days of a child's life and to help ensure that they get the best start to their lives. Chairperson, we are not without our challenges. One of our biggest concerns in the province is the continued attacks on our emergency medical services personnel. Since the beginning of the year, we've had 10 attacks on EMS staff and more than 230 attacks recorded between 2012 and 2016. What's most alarming is that these attacks happen in areas where the EMS services are mostly needed, and they are done by men and women known to our communities. These incidents hampers our ability to render the pre-hospital service that we need in these communities. I must, however, highlight that as much as this is a challenge for us, it was welcoming to see the response of community members in Khayelitsha and Kalksteenfontein after we engaged with them about the importance of keeping our staff safe. These communities is located in the districts where the highest stats on EMS attacks personnel were recorded between 2012 and 2016. It was also pleasing to note that our Minister of Community Safety, Dan Plato, committed to providing safety kiosks in the affected communities to ensure that our EMS personnel will be safeguarded. This will go a long way in helping our personnel so that they are able to fulfill their role in caring for those who need it most. Because we want to ensure that our residents have access to person-centered quality care, we've also allocated 40% of our more than 21.6 billion rand budget to district health services. This allows us to render facility-based district health services at clinics, community health centers, and district hospitals. And this is right where the people are in their own communities. So focused are we on providing quality health care that we also want to ensure that our residents have access to quality facilities. This is why we're emphasizing the importance of providing new health facilities while also refurbishing, upgrading, and maintaining existing facilities, and also utilizing technology that ties into the provision of health services. An excellent example of this, Chairperson, is the state-of-the-art clinic in Beaufort West, which replaced the old Hillside Clinic. The Green Clinic, as it calls, because it's an environmentally friendly building, was constructed at a cost of 23.5 million rand. Just to give you some insight, the corridors are wide enough to incorporate patient waiting areas and are located around landscape courtyards planted with indigenous saffron trees. It has energy-efficient lighting and solar water heating. Because of the dusty area where it's located, the building has ventilation chimneys which draws in air high above the ground where it is less dusty and take it down through rock stores underneath the building which temper the air before it goes to the air conditioning system. The clinic will also offer treatment for infectious and chronic diseases, oral health services, rehabilitation services, and specialized services for women and children. More than 50 other replacement, refurbished, and upgrading projects are further planned across the province for this year. Another initiative from this department, called the Back to Basics initiative, aims to reduce the waiting times of patients. To this end, the department has established over 2,500 alternate sites for the delivery of chronic medication to stable patients. The Mitchells Plain CDC came up with a Back to Basics system, which ensures that chronic patients receive their medication pre-packed and available for pickup on arrival. With this system, Chairperson, stable chronic patients effectively bypass the pharmacy and simply collect their medication. As a result, our overall waiting times at the pharmacy have been reduced from 185 minutes to 76 minutes. As the DA in the Western Cape, we really care about people's well-being and how they are treated. As stated earlier, we want to ensure that people have access to person-centered quality care. We will not let up on this vision and will continue to deliver quality care to the residents of this province in partnership with the National Department, other sister departments, local government, as well as external stakeholders. Chairperson, I thank you.
Thank you very much, Honorable Member. Honorable Hatting.
Thank you, Honorable Chair. During the past months, we had on many occasions people coming here, speaking from this podium, delivering their obligatory OR Tambo quote. And I would like to thank the Minister for today bringing a positive one of unifying something that actually belongs to the Rainbow Nation Madiba era. Some others come here like Honorable Dlamini and have quotes that is more intended to drive wedges, and I'm sure that the following O.R. Tambo quote was exactly meant for them. And I would like to quote O.R. Tambo: "Beware the wedge driver, watch his poisonous tongue." During a visit, Honourable Chair, to the Garib district a month ago, the comprehensive impact that the imploding rural governments are having on its inhabitants was once again highlighted. Services in the 9 clinics in the Kopanong local municipality are all subjected to water supply disruptions, sometimes lasting for days and on some days only being supplied with water for a few hours. Most of these clinics do have water tanks, not all, outside, but not being connected to internal water reticulation system causes the clinics to operate without water in wash basins or in toilets, leaving a healthcare facility.
Honorable Hati, can you take a seat?
Chair, every time when it's ANC members making noise, you just say, members, you're making noise. You don't call them out by their names or surnames. But when it's EFF members, you say, Koni, Mukwele, Shabangu, and all. It's not fair. Please, call Honorable Tlamini by name. Call Honorable Manopole by name. Call Honorable
Honorable
Nyambi
member,
by name.
Honorable
Please.
member, I'm not going to sustain that point. Can you continue? Can you continue, Honorable member? Can you continue, Honorable Hati?
Thank you, Honourable Chair. So it's a very unhygienic situation in these clinics. It's also therefore not strange to see nurses, assistant nurses, frequently moving through the waiting area through all the people with a bucket of water to flush and clean toilets that were used by the public. Quality health service delivery is further hampered in this area by vacancies of nurses at all 9 clinics, and I think my colleague from KwaZulu-Natal referred to that, because of the unavailability of qualified personnel as well as bureaucratic red tape. We've even found clinic managers acting for years. During the period between the previous 2 national census reports, the population in the municipality declined by approximately 25% to its current population of about 49,000. In this context, and despite 2 state-sponsored feasibility studies indicating that a new district hospital in Tromsburg is not viable, confirmed by a 3rd private feasibility study, a state-of-the-art hospital was regardless built in Tromsburg. And everybody should be celebrating today, but because the I think 20th suggested opening date is tomorrow, the 15th of June, we were promised. It should have been opened in 2013, 4 years ago, with costs now running up to about 3 times the original budget, and we can only hope to see that it opens tomorrow. If the promised opening in fact happens, it will only be limited to a maternity ward, a general ward, a pediatric ward, and 1 theatre. Several other wards and outpatient sections will not be opened. To achieve this, 71 strategic clinical posts, many of them unfunded, including 8 medical officers, 26 professional nurses, 17 staff nurses, 16 nursing assistants, etc., must be filled. A month ago, when we were there, no appointment figures were available. It is clear that this hospital, built on a political promise by you-know-who, at a massive cost to the taxpayer, with the closest medical specialist based in Bloemfontein, will not become a functional district hospital, ever. At most, it will become an assembly point for patients to be transported onward to Bloemfontein in order to receive proper medical care. It is not surprising that this hospital was built in the Free State, notorious for its exorbitant and wasteful projects, such as the failed multi-million-rand Gupta dairy farm in Vrede. The question, why did this happen? The answer that the building of clinics and district hospital is a provincial competency does not fly, because funding is sourced from conditional grants with conditions and expenditure monitored by the National Department. Further, there is a constitutional obligation between different spheres of government that they are interdependent and interrelated and therefore do not operate in silos. With limited capital and human resources available, responsible and proper planning is crucial if the department is serious in meeting its targets as set out in the National Development Plan. And wasteful expenditure such as this, 3 times the original amount, 4 years late, certainly does not contribute to the plan envisaged by the department in fulfilling its obligations in the National Development Plan. I thank you.
Thank you very much, Honorable Member. Honorable Moshodu.
Thanks, Honorable Deputy Chairperson of the NCOP, Honorable Chief Whip, Honorable Minister of Health, Ndate Motsoaledi, Deputy Minister, Honorable MEC, Honorable Members, ladies and gentlemen. The ANC support this budget vote. Honorable Chairperson, the 53rd National Conference in Mangaung noted that primary health care is the heartbeat of any sustainable health system globally. It also noted that the primary health care remains as a core of the overhauling of the health system and the NHI in South Africa. Honorable Chairperson, as we debate this budget, we need to look back whether as the people's movement and the government of the people, how far have we turned these wishes of the majority of the poor in reality? Honorable Chairperson, I want to applaud the National Department of Health on the achievement it has made during the past year. Honorable Deputy Chairperson, the NCOP recently undertook a pre-visit of taking Parliament to the People Program to the Carib region in the Free State. Honorable Minister, most of the primary health care facilities are in a good state as far as service delivery is concerned. But there are those that the condition require improvement, such as the EMS depot in Kofifontein. I'm sure, Honorable Deputy Chairperson, as a leader of that Litsimeng Luena maikutlo hao a tla theoha ha ke bua ka ntho EMS.
Debate, don't put me on a spot.
Modulasetulo ntumelle ke bue le setjhaba sa South Africa. Ka ho tloloha ke bue le province ya Free State mo ke tswang teng. Honorable Minister, ha o sheba matona a hao kaofela, o hlokometse hore letona la Freistata Ntate Khompela Butana Khompela ha ayo kasheko. Lebaka le teng, Honorable Minister, la hore na hobaneng a le siyo. Ke ka lebaka la hobaneng re le mmuso wa Freistata re baetapele ba ya thehang tsebe ba mamelang seo setjhaba se se hlokang. Ka morao ba NCOP e tswe mane Free State. Re la ga dula fatshe le MEC ga sheba tse ding tsa ditlhoko tse re di boneng di hlokahala regioning e re ne re tswa ho yona ya Garipi. E re ke qale mona Honorable Minister ko ho bolelle hore letsatsing la kasheko mane Freistata Mangaung re a hlasela re Free State re fa baahi ba mono kliniki e ntjha e bitswang Batho Clinic. Ke kliniki e ntle ka tsela e makatsang, Honorable Minister. Ha re a fella moo. Hosane ha letsatsi le tjhaba. Re tlebe re kene lebilong, re matha re ya mane motseng wa Garib region. Masipaleng wa Letsimeng municipality. Re ya mane toropaneng e bitswang Tronsberg. Teng, Honorable Minister, re tlabe re lo bula sepetlele se bitswang Albert Nzo Hospital. Re a hlasela re Free State. Ha ke no makala, Honorable Chair, ha member ya DA a tlo ema mona a complaina ka taba ya go sepetlele se bula neneng a sa tlameha ho bula neneng. Ke rata hore baahi ba mane Free State le mametse ebile le a bona hore ba teng ba bang ba sa batleng ho bona ditshebeletso tse ntle di tla ho lona. Ke ka ho ha re ya re potlakile re lo di bulela hospitala ba bang ba tlo ema mona ba complaina hore na se bulwa neneng because ba tseba bona hore ha mmoho le bana ba bona ba fumana ditshebeletso tse lokileng. Re a leboha mmuso wa Free State, re a leboha hangwe, re a leboha habedi, re a leboha hararo. Honorable Chairperson, it was also a conference resolution that, under the heading of the PICC, a comprehensive audit of all health infrastructure be conducted, revitalization and refurbishment of all sustainable infrastructure be executed by 2025 using the public fund and public-private partnership where appropriate. The departmental program infrastructure should look into a way of improving such infrastructure in remote areas of our country, like in the Carib region, as these are the only accessible healthcare centers that can make or break rural communities' wishes of a better life for all. Where do you live? Honorable Chairperson, I know the Minister is very passionate about the inaccessibility of health services to the poor due to the high cost of medical aid. Also, the Mangaung Conference noted the extremely exorbitant fees charges in private healthcare, which have increased health inflation, and thus resolved that a national pricing commission be established to regulate the healthcare in the private sector by 2013. This progress needs to be prioritized. Honorable Chairperson, program number 2 of the START plan seeks to improve access of quality healthcare services through the development and implementation of policies to achieve universal health coverage. Health in financing reform, integrated health system planning, monitoring and evaluation, and research. The successful implementation of this program should address some of the problems I have already raised above. It was the ANC wish at the conference that the government should set up the NHI with the agency it deserves during the state fund by the end of 2014. The ANC should continue to guide and oversee government process of developing the white paper and legislation of the NHI in 2013. The department's strategic objective to achieve the universal health coverage through the phases implementation of the NHI will only be achieved when the white paper of the NHI is gazetted into a policy document in 2017-2018 financial year. Honorable Chairperson and Honorable Minister, program number 3 of the department seeks to develop and monitor implementation of national policies, guidelines, norms, and standards needed to decrease the burden of the disease associated with the burden of HIV and TB epidemics and optimize good health of children, adolescents, and women. These go a long way in accommodating our conference resolution that consultation of parent on school health program in relation to reproductive health rights, HIV counseling, testing, and prevention of sexual transmitted infections. Honorable Chairperson, though the budget and the START plan are not fully addressing the wish list of the people, I believe it also addresses key issues that will improve the life of the people and the public in general. We are aware of the economic situation in the country and the world at large. We are technically in the recession of as not economic growth has been reported in the last 2 successive quarters. Thus the budget overstretched and we have to do more with the little we have. Modula Stulo, ntumelle ke boela hape province ya Freistata ha ke tla diela dikgala ka hore Ha re ya dikgethong tse re di lebileng, le a bona le shebile ebile le mametse mekgatlo e ya mona e rejectang di-budget tsa bophelo ba lona bo botle. Re eme mona re le ANC jwalo ka mmuso wa batho, ha re ke be re le balele ha o le thata, re support-a hore tsa bophelo bo botle di tle ho lona. Re tla dula re ntse re etsa jwalo, re kopa le province ya Freistata le behe pele sekotlolong. Come 2019, more especially in the Free State, ke kopa hore re votele ANC back to the power. Thank you, Honorable Chairperson.
No, thank you very much, Honorable Member. May I therefore call on the Minister to conclude the debate? Honorable Minister, conclude the debate.
Thank you, Chairperson of the House. Baba Kaul, kwenze njani? What's going on here? What's going on? You know, this issue is prompting me to give a very clear answer. This story, which is repeating itself again and again, that we've got certain doctors who can't do internship and community service. You know, I sat with the department, we dealt with this issue. I even went to the radio to talk about it because I don't know what else must I do. Let me give you the facts. Internship is statutory. Any doctor who has passed medicine has to do internship. It is statutory. Now, this can't, so it means the state is obliged to give that person a job. Now, community service is also, it's compulsory. You can't do anything in medicine until you finish community service. So the state of obliged, I'm obliged. So whenever there are these stories that there's no work, I go to the MECs and shout at them because how am I going to explain this? Now let me tell you what's happening. And every time I repeat this, people believe I'm dodgy. Somebody even said I'm propagating fake news. Medical students, when they apply for community service or for internship, they want to work in 4 places. It's Cape Town, it's Johannesburg, it's Durban, it's Pretoria. If we are lucky, then they will choose Port Elizabeth and East London, if you are lucky. But mostly this. So the crowd, they apply. So we said, let's control this issue centrally. Let me tell you what happened early this year. There were 1,409 applications for internship position. We placed all of them, but 17 declined. They said we can't go. In fact, in the Western Cape, when they decline, they even wait for 6 months for the second intake, because the second intake of interns is in July. Yes, they prefer to wait for 6 months than go where the job is. Now, let me give you these facts again. On the 22nd of May, I was at the World Health Assembly, as I said. I was phoned by a gentleman who said his daughter-in-law passed medicine in December last year. She still doesn't have a job. And he was appealing to me. I spoke to him, asked him questions. He couldn't answer. I said, sir, your daughter-in-law is a doctor. It's not a baby. Can she phone me directly? Let's talk directly. And she told me straight that she's married here in Cape Town and she can't leave. And I even checked where she was given a job. Because we put them all over the country, she said she can't leave. When she can't leave, the answer is that she must wait for the July intake. Right? The gentleman phoned me again on the 7th of June, harassing me that my daughter is still waiting. But I said the July intake is still coming. She phoned again this morning at 10 o'clock. A program called Liitlo Las Chaba in SABC2 interviewed me on the 6th of June. They said there are 80 doctors who have got no jobs. I said, please give me the list. Today, I'm still waiting. When you mentioned this, you saw me going out. I phoned my Spokesperson, I said, tell that lady from Little Chaba to give me a list of 80 doctors within jobs. Answer. It's here on my cell. Answer. She said she'll provide it tomorrow. But she told me on the 2nd of June. I actually did not finish the story. The young lady, when I was in Geneva, I said, I know only 17 doctors who declined their job. She said, no, there are 50 of us. I said, send me a list. Immediately. 4 hours later, the list was not there. Yes. Then the following day, I phoned her. I want that list. Then I got 22, not 50. And when we check on our list, these are the 22 who declined jobs when we were giving them. The MEC for KZN, before he left Kaula, he sent me this message. There are 4 doctors in Durban who have finished second-year internship but are not willing to take post of community service outside Durban. This is this message. So this is what we're dealing with. What reasons Chairperson today give? We even have percentages. 54% quote marriage as a reason why they can't take jobs elsewhere, why they can't leave this area. 11% quote religion. I don't have a percentage here because I'm sitting there, but it's in the office. About those who quote property, illness, and legal matters. These are the 5 reasons given. 54% marriage, 11% religion, property, illness, and cases. What do we mean by property? One even said he has just bought a very expensive horse, he can't leave it. So these are the things we are dealing with. Now, I want society to understand because we have to give these jobs to everybody. It's a statutory. Now, Baba Kaola, in front of everybody, I want your list. Can I get your list? Please. Because now I'm waiting. That will be the 3rd list I'm waiting for. No, I want your list. That lady from Little Chaba has got a list of 80. This young lady here has got a list of 50. How many? No, it's 18 Little Chaba. 50 here. Where is yours? Please, Baba Kaule. This is not harassment. I'm really asking you. I'm serious.
No. The minister did say through me. Through you,
yes,
the chair.
Through you. No, I forgot the last one. In April, it was business day. 211 doctors without jobs. I was very angry, and I phoned the unit dealing with this matter. We checked. Guess what we discovered? The 211 are still medical students who are due to write exams. Yes. They are still to write exams, and we have already registered in them. And when they registered, it was 263. When we went to check, we found that 34 are duplicates. What does it mean? When they register many times, hoping that no. Yes, I'm begging here. So this thing, please help us, but I want your list. Because I don't want any doctor without a job, especially an intern or a community service. Because it's wrong, because we are holding back their lives. Please, your list, then I'll have the 3 lists I'll see. 50, 80, and yours. Thank you.
No, thank you very much. Thank you very much, Minister. Order. Honorable members, may I take the opportunity then to thank the Minister, the Deputy Minister, MEC, Limpopo, who was able to sit throughout, and including those who submitted their requests. And we are quite encouraged to the extent that there's a greater interest now. 2017 has taken a different direction. We see a greater participation of MECs, especially from provinces, because it assists us as a council to get a provincial perspective of what is happening and so forth, and live up to our constitutional responsibility as a council of provinces. So thank you very much, ma'am. That concludes the debate. The secretary will read the second order of the day.
Policy debate on budget vote number 9, public enterprises.
Welcome, Honorable Lynn Brown, as the Minister, and can you introduce the debate?
Honorable Chairperson, good afternoon. Honorable Ministers and Deputy Ministers, Chairperson of the Select Committee, Honorable Ellen Prince, members of the Select Committee, honorable members, distinguished guests, ladies and gentlemen. Honorable Chairperson, it is indeed a privilege for me today, on the eve of the 41st and commemoration of the Youth Day, to be addressing you. We salute the youth who sacrificed their lives for our democracy. 23 years ago, we attained political freedom. Since then, we have erased racist and discriminatory legislation from the statute books, built millions of houses, connected tens of millions of South Africans to the electricity, water, and sewage networks, constructed schools, clinics, roads, and other infrastructure. But millions of our people remain mired in poverty and unemployment. Inequality has persisted. We have collectively failed to effect the economic transformation required to create a fair and sustainable society for all. Well-managed and well-maintained state-owned companies are uniquely positioned to contribute to addressing the chasm between rich and poor South Africans. Indeed, they are a critical tool in the hands of the developmental state. It is imperative that the fog of allegations of corruption that have enveloped some of the state-owned companies over the past year are lifted through a definitive investigation, followed by appropriate legal processes if required. I will return to the subject shortly. Chairperson, as President O.R. Tambo remarked in 1981, the objective of our struggle in South Africa, as set out in the Freedom Charter, encompasses economic participation. It is inconceivable for liberation to have meaning without a return of the wealth of the country to the people as a whole. 36 years later, delivering the State of the Nation address in February, President Zuma defined the need for radical socio-economic transformation. We mean fundamental change in the structures, systems, institutions, and patterns of ownership, management, and control of the economy in favor of all South Africans, especially the poor. And I close the quotes. State-owned companies in the DPE portfolio, Eskom, Transnet, Denel, SA Express, Alexcor, and Safcol, have been given their marching orders to deliver on this mandate. It is important to note that South Africa is not alone in looking at its state-owned companies to lead the advancement of its economy. Globally, the early 1990s, push by multilateral institutions such as the World Bank for a free market system with complete liberalization is giving way to a more pragmatic approach that acknowledges that market liberalization policies do not always accord with nations' developmental aspirations. In 2005, 9% of global Fortune 500 companies were state-owned. By 2014, this number had jumped to 23%. The larger companies in my department stable are among the key economic levers available to the state to give effect to its transformative developmental agenda. While many private companies were forced into their shells over the past nearly 10 years of economic sluggishness, state-owned companies have undertaken massive infrastructure and job-creating projects. The overwhelming majority of goods and services supplied to Eskom, Transnet, and Denel, our big three, are not supplied by black-owned or empowered companies. There is enormous scope to transform the profile of suppliers, bring in new companies, and convince owners of existing suppliers to enter into profit-sharing arrangements with workers, among other measures. Chairperson, we must confront and overcome the allegations and counter-allegations of corruption in state-owned companies and set about our transformative journey in a climate of the highest ethics and responsibility. Thank you. Thus contributing to the rating agencies' reversing their recent decisions in the shortest possible time. As the Minister of Public Enterprises, it is my task to perform the function of shareholder representative over the 6 companies in the department's holder. As a shareholder, one doesn't attend meetings of companies, company boards, or executives. One relies on the boards and executives for operational information. It is the responsibility of the shareholders' representative to formally appoint boards, following complex consultative processes, maintain policy oversight, sign off financial proposals above a particular value, often in conjunction with the Minister of Finance, as the PFMA requires, and to participate in annual general meetings. Boards are responsible for governance, including for fiduciary responsibility over procurement processes, and executives are responsible for the actual operations. In 2007, South Africa first experienced load shedding. Since then, there have been at least 7 investigations into alleged maladministration and corruption at the utility. Several were commissioned by Eskom's board, culminating in the publication of the State of Capture report 6 months ago. Eskom's reputation has been torn to shreds. The facts of its financial turnaround, that it has used only 200 billion rand of its government guarantee of 350 billion rand, that the build program is ahead of its revised schedule, that it is making do with a 2.2% tariff hike, and that memories of load shedding are fading, are totally lost to the state capture discourse. Since January, I've been calling for further investigation to clear the fog. I'm very pleased to hear that the President has agreed that he would have the Commission of Inquiry. About 2 months ago, I instructed my department to draw up the terms of reference for a broad scope inquiry into affairs at Eskom since 2008. The constitution of the inquiry has yet to be finalized. The DG has already met with the head of the SIU, and they are working on a structured process to filter issues which can be dealt with in the department and those that would require independent investigation. This process would culminate in a presidential proclamation to take the process forward. Beyond Eskom, state-owned companies will take heart from the ANC support for a judicial commission and the Hawks announcement of an investigation into state capture. Chairperson, the debts of large SOCs are linked to the sovereign credit ratings. The SOC reform project, which is chaired by the Deputy President, and the development of a shareholder policy led by my department will implement recommendations of the report of the Presidential Review Committee on SOEs. It is clear that state-owned companies' improvement in performance is a non-negotiable. Structural reforms must be accelerated to improve efficiency and strengthen government's role as a shareholder. The principles of the shareholder policy were approved by Cabinet in November 2016 for further consultation. The project plan anticipates that the legislative program for 2017-18 will see the introduction of the draft shareholder management bill. Cabinet has approved a new SOC remuneration and incentive standards for non-executive directors, executive directors, and prescribed officers. The guiding principles ensure that performance is transparently linked to incentives. Before focusing on company performance highlights, a brief word about the department. The Department of Public Enterprises realignment process is gaining a momentum. It is being repositioned to become more agile, responsive, and efficient in fulfilling its oversight and monitoring roles. The department spent 253.8 million rand of its 2016-17 budget allocation, 94.7% of the total budget. I commend the department for spending 99.4% of its goods and services budget. The underspending of 14.1 million rand is primarily due to vacant posts. The DG has presented a plan to expedite filling these posts. The department has been allocated a budget of 266.7 million rand in 2017-18, 277.2 million in 18-19, and 296.5 million in 2019-20. And now a quick run through the companies. Eskom 2 years ago was on the brink of financial collapse, and load shedding was the norm. Today we have generation reserves of 3,000 megawatts, and Eskom's managed to keep plant energy availability over 77.34%. It's up from 60% in 2014. A total of 153 megawatts of renewable IPPs went into commercial operation in December 2016, which will bring total contribution of renewable IPPs to the national grid to 4,180 megawatts. Government, led by the Department of Energy, is finalizing the IRP, which will outline the final energy mix for the country. Part of that process will affirm decisions about economic life of all our power stations. Because Eskom is a strategic role player in the economy, government continues to support the completion of its build program. The government framework agreement expired in March 2017, and it was extended to 2023 to enable Eskom to tap capital markets to fund the program. The program is delivering and it is ahead of the revised build program deadlines. Ingwa is in full operation, and Medupi Units 5 and 6 are commercialized. Kusile Unit 1 has been in commercial operation, and Medupi Unit 4 is in synchronization of, operation, which means it only produces about 100 megawatts of the normal 800 megawatts that it should produce. When in Ngula, pump storage reached commercial operation, an additional 1,332 megawatts of peaking power was added to the national grid. Eskom is expected to record a profit for 2016-17 financial year and will continue its cross-border trade program to boost declining local demand. Engagements with municipalities, Salga and Kokta, to manage municipal debts continue. Solutions must be found to assist municipality without income-generating bases that resort to using funds allocated to the payment of electricity for daily operations. Eskom's asset base increased to 691.7 billion rand in the third quarter of 2016, up from 644.4 billion in the previous year, mainly due to the addition of Ngula. Government aims to reach universal electricity access by 2025. In 2016-2017, over 200,000 households were connected to the grid. The current negative economic growth, both locally and internationally, has necessitated that Transnet revise the targets of the CapEx investment program. The market demand strategy responds to South Africa's industrialization requirements. Instead of being implemented over 7 years, it will be implemented over 10 years with the intention to advance South Africa's developmental objectives, including enterprise development, localization, and job creation. The strategy to revitalize branch lines to support its road to rail strategy is gaining traction, with Transnet Board approving 3 branch line transactions: Belmont to Douglas, Ceres, Prince Alfred Hamlet and Worsley, Allisdale, Grahamstown, and Port Alfred. Branch lines are the train lines and train stations in small rural communities that a couple of years have been closed down because it was not part of the core business. The company delivered 37 passenger coaches engineered and manufactured at its Centre of Excellence in Pretoria and Cape Town to Botswana Railways. The successful delivery confirms the strides the Transnet division has taken as it aggressively advances towards becoming South Africa's leading manufacturer of rolling stock. In addition, the development of the Trans-Africa locomotive, the first diesel locomotive designed and built in Africa for African conditions, aligns perfectly with Transnet's Africa strategy and the company's vision to become the leading provider of logistics services in sub-Saharan Africa. The company should announce a profit for the 2016-17 financial year. The global airline industry is experiencing radical economic turbulence, and South African Express has not been unaffected. South Africa Express improved its financial performance in the 15-16 financial year from a 69.4 million rand net loss in the previous year to a profit of 16.9 million. This was mainly due to cost savings of 330 million, partially offset by the decrease in revenue of 203 million year on year. The revenue decrease is attributable to the 7% decrease in passenger numbers from 1.4 million to 1.3 million. Although this decline is partly due to a reduction in capacity as a consequence of austerity measures, the airline should explore other initiatives that will ensure sustainable revenue growth. The continued decline in revenue does not ensure that the airline will be able to meet its operating costs. In 2015-16, the entity remained solvent with equity of 131 million rand. However, the risk of insolvency remains high should South Africa Express be unable to generate profits from 2016-17. There is a bit of light at the end of the tunnel. I expect the task team appointed by National Treasury to submit proposals on the end state for government's airline assets, namely South African Airways, Mango, and South African Express within the next couple of weeks. Alexco is a diamond mining company operating primarily in Alexander Bay and the Greater Namaqualand region. Its operations include both marine and land mining. During the current financial year, the department completed a desktop study on the Richtersveld diamond deposit. This study confirmed it is possible to extend the life of the Alexco pooling and sharing joint venture beyond its current estimated 10-year lifespan. Alexco experienced operational challenges during the 2016-17 financial year. It did not meet its carat production targets set for the year under review. However, its diamond revenue increased from 386.5 million in 2015-16 to 758 million in 2016-2017. Additional economic opportunities for the community of Richtersveld and its environs are expected as mining operations expand in the next 2 to 3 years. With regard to Denel, the Portfolio Committee at its meeting of the 24th of May resolved to hold a meeting at the earliest opportunity with the Board of Denel and officials of National Treasury to resolve issues pertaining to Denel Asia. Pursuant to the resignation of the former Group Chief Executive and Chief Financial Officer in 2015, The Denel board has finalized its recruitment for both positions and have made recommendations to me. Denel continues to grow its revenue. Its acquisition of Land Systems South Africa will enhance its capability to design and manufacture multi-purpose armored vehicles that will enable it to compete in lucrative international markets. Furthermore, the development of the small African regional aircraft, the SARA, is proceeding according to plan. Denel's aerostructures delivery on the Airbus A400M contract continues with on-time and on-specification deliveries. Chairperson, before wrapping up, SAFCOL. SAFCOL manages and develops commercial forests. Its activities include timber harvesting and processing. During the 15-16 financial year, the department conducted a review of SAFCOL's financial position. The company has a sound balance sheet that can support its capital expenditure over the medium term. Changes to the company's executive committee have had a negative impact, and the board has been reminded by the ministry to speed up the recruitment of a chief executive officer. Chairperson, before wrapping up, a quick word about state-owned companies' corporate social investment programs. Between all 6 state-owned companies in my portfolio, they enrolled 8,931 trainees in 2016 in various scarce job and critical skills programs. So it's in engineering, scientists, doctors, maths, but in 1 year, up to December 2016, they enrolled 8,931 trainees. A total of 10,655 trainees in various disciplines graduated over the past year. 607 of them have been employed, and that's the role that state-owned companies can play. It can play an important role in building up the artisanal, its engineering, its high-end skill for the economy. And I'm very pleased that last year, again, December 2016, 1,779 learners have received bursaries for the current financial year. And those bursaries were also received in the high-end areas of skill or the scarce skill areas like engineering, scientists, and other stuff. In conclusion, Chairperson, I'd like to thank the Honourable former Deputy Minister, Bulelani Magwanishe, for his excellent support over the years, and I warmly welcome the new Deputy Minister, Ben Martins, who is no stranger to this department since he's been a Deputy Minister for Public Enterprises before. I also want to thank the board and executives of the state-owned companies, my department, senior management. I'd like to thank the chair and the select committee, where we've always been able to have cordial engagements. And I hereby table budget vote number 9 of the Department of Public Enterprises. I thank you.
Thank you. Thank you, Honorable Minister. Let me now invite the Honorable Prince, who is the Chairperson of the Select Committee on Communication and Public Enterprises.
Honorable Chairperson, Honorable Minister Brown, members of this House, ladies and gentlemen. In this year that we are celebrating one of our leaders in the ANC, the late Oliver Tambo, it is important that we are reminded of his words when he said, and I quote, "We have a vision of South Africa in which black and white shall live and work together as equals in conditions of peace and prosperity, unquote. In these days, we are seeing and hearing so many racial slurs when leaders of political parties are using all kinds of methods to paint a picture of how bad South Africa has become under the reign of the ANC. Many of the critics with the opposition parties at the helm of this criticism are not able to acknowledge the reality of the challenging times and the forces that influence these challenging times, where economic growth is slow and unemployment, poverty, and inequalities continue to characterize the country's political landscape. Chairperson, one of the most important factors in creating growth is for the government to put legislation and plans in place to enable growth. This we have done over the past 23 years. We have created an enabling environment, but it is for the private sector's responsibility to contribute to job creation and thus alleviation, poverty and inequalities. The National Development Plan makes it obligatory to all of us in our respective roles as legislatures and members of the cabinet to be in a position that allows us to decisively tackle the triple evils of poverty, unemployment, and inequality. To do that requires us to make use of the limited resources available to us and to do so effectively, which we are doing. It is in that context that we welcome the Department of Public Enterprises budget, whilst also taking into account capital requirements of some of the state-owned companies under the jurisdiction. We trust that the department will be able to utilize its skilled and experienced personnel in prudently disbursing its budget in fulfilling its mandate and reaching its strategic objectives of: 1, the promotion of the independent financial sustainability of state-owned companies and the commercial viability of their operations. 2, the promotion of transformation in their value chain and their suppliers to actualize broad-based black economic empowerment through the creation of jobs, skills development, and inclusive growth. 3, the creation of an enabling policy, regulatory, and operating environment for state-owned companies. Chairperson, it needs to be noted that the Honourable Minister Lynn Brown is committed to ensuring...
Sorry, can you take your seat? Honourable Koni, why are you standing?
I was actually standing on one point of order, but now it's two. Because as I was standing up, the Honorable Klimbi on my left here said he wants to go and sleep. I'm actually delaying him. So the last time I checked, we are here to work. Let me get to the point that I was standing for, Chairperson. Can the member on the podium address us standing up? Thank you.
No, maybe it will be in order to remind those that got in after Honorable Deputy Chairperson has addressed some of the issues that are very important for the decorum of the House. He highlighted that as presiding officers who have noted some members have taken upon themselves to want to question, debate, overturn, and in some instances defy presiding officers, and he cited the number of rules. Then he reminded members that it's our responsibility to make it upon ourselves that at all times we do anything that won't compromise the decorum of the House. That was the essence of the message of the Honorable Deputy Chairperson. Can you continue, Honorable Prince? Honorable Koni was out of order.
Thank you, Honorable Chairperson.
it seems like all the resolutions that are taken with regards to the behavior of members in this house are only directed to the EFF members. I don't know why you are reading the same thing that Honorable Tau told me or read to me. I don't know why you are not doing the same thing to the ANC members who are making noise and who are not respecting this house. So you are saying this to me, I don't know if it's because the very same words you just said to me are directed to the EFF only.
No, it's for all the members.
It's
Can you
going to be
take
for
your
the
seat?
second time today. Allow me to finish.
No, you can't
It's
finish.
going to be the
You
second
can't
time
finish
today
because
that I call you
are
to
not
order on
making
your
a point of order.
inconsistency.
Can you take your seat?
And you are biased and you continue to be biased. And I'm warning you, Chairperson.
Continue, Honorable Prince.
Thank you, Chairperson. It needs to be noted that the Honourable Minister Lynn Brown is committed to ensuring that the department remains focused and amidst so many negative reports from the media. This includes her approach in keeping the public informed of issues involving any of the state-owned companies. What is, however, clear to us all is that South Africa, with all its challenges, cannot survive without the strategic role played by the state-owned companies. This requires of us that we must always remind ourselves of the reason for establishing state-owned companies. State-owned companies were established for the following main reasons: to invest in sectors in which the private sector is either unwilling or unable to provide the necessary skills requisite for the country's growth prospects, and to provide the necessary infrastructure in order to keep the country's economy growing. This continues to define the role state-owned companies play in the economy and in our society at large. Take, for example, Eskom's electrification program, which started soon after the new democratic dispensation, and today has connected 87% of the South African population, compared to only 35% under the previous regime. The provision of electricity is particularly important in alleviating poverty, and Eskom has been providing municipalities with free basic electricity within the parameters of the electricity basic service support tariffs, which entitles poor households for free 50 kilowatt per hour power per month. It is important that Eskom provides the necessary electricity and keeps on running, not only as far as households are concerned, but as a driver within the economy. Chairperson, Transnet Pelopela train, has for many years been bringing health services for free to rural communities, and thus extending the health and life of the rural poor. South Africa Express, and despite her own challenges, has made major strides in training and developing young pilots from disadvantaged backgrounds through her cadet pilot program, and is thus transforming the airline industry. These are just a few examples that demonstrate the fact that state-owned companies are playing its role of giving access to previously disadvantaged groups into sectors and industries previously enjoyed by a select few. Chairperson, this narrative is not different from that of the media, which tend to give the impression that state-owned companies are on a free fall financially, and that complying to corporate governance principles is no longer a matter of concern. None of the state-owned companies under the Department of Public Enterprises have received any adverse audit findings except for one, namely South African Express. In cases where adherence to corporate governance principles has been breached, the department has, in accordance with its mandate, addressed such matters. A few weeks back, Minister Lynn Brown, whilst addressing the House, referred to the establishment of a broad scope inquiry into the affairs of Eskom, and indications once more of the Minister's commitment to adhering to good corporate governance principles. In our engagements with the Department of Public Enterprises and the various state-owned companies, We have identified a number of factors which, in our opinion, can improve the performance of state-owned companies. An overarching legislation on state-owned companies will enable the minister to conduct effective oversight over SOCs and properly improve their performance. The new legislation must also clarify the mandate of state-owned companies regarding the powers and the oversight functions of the department. This includes identifying explaining the different roles of each of the key stakeholders, such as executive managers of SOCs and the boards and the ministry itself. Chairperson, this therefore means that the task of the interministerial committee led by the Deputy President working on the recommendations of the Presidential Review Committee on SOCs becomes even more important to us regarding the introduction of the new and overarching legislation. The initiatives that certain of these SOCs having taken and implemented is an indication of the department's seriousness to create prosperity for a vast number of people in the country. Let's have a look at some of these initiatives. Firstly, Transnet has partnered with the Design Institute of the South African Bureau of Standards to establish the Transnet Innovation and Design Research Center. The partnership promotes a culture of innovation and entrepreneurship. Through its Moving Ideas concept, more than 1,200 young entrepreneurs were invited to submit life-changing innovation ideas that would provide solutions to challenges in their communities and some of Transnet's operational challenges. Secondly, as far as skills development is concerned, between them, the 6 state-owned companies in the portfolio have enrolled 8,931 trainees
Honorable
as
Prince.
at 31st
Sorry,
of
Honorable
December.
Prince. Honorable Isaac.
Chairperson, with your permission, will the member take a question?
Honorable Prince, are you ready to take a question? No, he's not ready to take a question. Take your seat, Honorable Isaac.
Of course, I'll take.
Thank you very much, member. The whole time while I was sitting there, me and you was interacting, so you could ask your question that time. Honorable Chairperson, between them, the 6 state-owned companies in the portfolio have enrolled 8,933 trainees as at 31st December 2016 in various scarce job and critical skills programs. A total of 10,655 trainees in various disciplines graduated from a variety of programs over the past year, 607 of whom has been employed. The minister also referred to that. And 1,779 learners have received bursaries for the current financial year. I trust, Honourable Minister, that the Western Cape receive its share in these developments. Both Alexco and Safcol are doing well in the future looks bright, and the future look bright in terms of expansion and possible job creation. Alexco increased its diamonds revenue from 3,386.5 million in 2015-16 to 758 million in 2016-17. As far as Safcol is concerned, I would hope that it expands its operation into the Western Cape to create wealth in conjunction with the Department of Forestry. The NELS Physical Science and Mathematics Outreach Program to schools in indigenous community continues to yield excellent results. As the 2016 matriculant results in the Free State Province is proof of the success of the program. Chairperson, we would welcome an extension of the program to be implemented in the rural areas. Finally, improving our economic situation and bringing stability to all the other factors that have resulted to our sovereign being downgraded will require our collective effort. The task of creating and building a non-racial, non-sexist, democratic and prosperous South Africa cannot be achieved through finger-pointing. Chairperson, as the ANC, we realize that at the moment there are many issues that poses many challenges in terms of good governance. We as government are committed to deal with these issues and challenges in order to rectify it. We will deal with it responsibly in the harshest possible way, and we will bring to book those who are jeopardizing the progress in the country and the cost of all the people who live and work here. In conclusion, as a nation, we need to embrace the challenges and stay focused to reach our full potential. As the ANC, we support this budget vote. I thank you.
Thank you. Honorable Labuskakni. Honorable Labuskakni, sorry. You can take your seat. Let me deal with Honorable Mikalakis. Honorable Mikalakis.
Thank you, Honourable House Chairperson. Sorry to have to do that to my colleague. However, just on a point of order, I see that your name is number 12 on the speaker's list. If you are speaking, it would be highly irregular of you to preside during this debate if you are going to take part in the debate. I would just like some clarity with regards to that. It is practice that a presiding officer cannot take part and preside in the same debate because you are going to engage the members later. If that is the case, then I would suggest and request that we find another presiding officer to ensure that the debate is impartial.
It doesn't make any difference. You're out of order. Can you take your seat? Can you take your seat?
Honourable House Chairperson, it is practice that you cannot take part in the debate and preside in the same debate.
Can you take your seat?
It's not impartial.
Can you take your seat? Close that mic so that I can make my ruling. Honorable Mikalakis. Honorable Mikalakis, we are making a point of order, and that is not even a point of order. Can you continue, Honorable Labuskakni?
Honourable Chairperson, I actually, on a point of order from the podium, agree with my colleague.
Can you I said you take your seat. I'm dealing with Honorable Julius. Honorable Julius?
Chairperson, it is practice. You cannot be the referee and the player. You know it. You cannot be the referee and player. We cannot continue with this debate with you sitting there. You cannot be partial because you will come back later on and you will be part of this debate. So you are a player and a referee. My suggestion is we have table staff. Why don't we ask them for their opinion because you are ruling on yourself?
Let me assist you.
Point of orders against you.
Take
How
your
can
seat.
you rule against yourself?
Let me assist you. There's a precedent in the House. It's not something that is happening for the first time. Probably when we're debating the budget of Parliament, we're not here. I presided, I went and debated. The chairperson has done the very same thing. It's not something that is new. It's not something that is new. Honorable Mikalakis, not unless you are rising on a different matter. If you are rising on the same matter, I've made my ruling, and if you've got a problem with it, there's a procedure of how to deal with it.
Honourable House Chairperson, I respect your ruling. However, I would sincerely request that you speak to the table staff for advice on this matter. It was first the matter of the quorum, now this matter. You do not want egg on your...
Can you switch the mic off? Honorable Mikalakis, if I have made a ruling and you have got a problem, that is why Honorable Tau assisted the House when it started. If you've got a problem with the ruling, there's a procedure that you can follow. Even if I can be assisted, there's no way that I will change my ruling. I'll stick with my ruling. Can you continue, Honorable Labuskakni? Honorable Kone?
Ke a leboga modulasetilo. Ke kopa gore o kope tlhotlhomišo mo go mme le rre ba ba dutse mo pele ga gago ka gore e ka re le wena ga o tlhaloganye tsamaišo ya ntlo e. Ba go tlhotlhomisetse gore a tsela e ke tsela e go tsamaiwang ka yone ka gore ke bona matlhogo a taboga le ntlo e yotlhe se šupitsa gore ga o itse gore go diragala eng or go tshwanetse gore go diragale eng ra itse gore le lekoko le le tseileng puso mme ga gore gore ha le lekoko le tseileng puso le ntlo e le tla e gataka ka jaaka lo batla mo te ga ntlo e ke maloko a dipati tse di harologaneng re tsewe ka go lekana yana ke kopa gore o kope thuso mo pele ga re le mme ba ditse mo pele ga gago pele ga re tsamaisa tiro ya ntlo e ke a leboga.
Honorable Koni, you are not raising a point of order. Can you take a seat, Honorable Chabang? I'm not going to go out because you are saying I must go out. Can you continue, Honorable Labuskachne? Honorable Labuskachne? I'm not recognizing you. I'm not recognizing you. Can you continue, Honorable Labuskachne?
Order, honorable members. Order, honorable members. Honorable Mikalakis.
Thank you, Honorable
recognize
Deputy
you.
Chairperson. That's the first time I ever clapped for you, and hopefully the last. No offense. Honorable Deputy Chairperson, the House Chairperson just made a ruling, and I would like your clarity on this matter. Is it now a new precedent in this House that a presiding officer may take part in a debate and preside? Because if you rule that that is the new precedent, then we must deal with it in that manner. But I believe that it is not according to the rules and the processes of this House, and I would like your clarity on it, please.
Honorable members, I take it that we are. No, let me just respond to that. Let's take it. Honorable members, can I just address that, honorable member? Take your seat for now. Can you just take your seat for now? Honorable members, I take it that, look, there is a precedence. There is a precedence. I mean, it's not even the first time. If you can still remember, in one instance, we had even the chairperson participating in a debate and still presiding over the sitting of the House. But I think it's a matter that we need to deal with politically, beyond this sitting and so forth, just so that we get clarity. We are adults as we are sitting here. I've been presiding since 2 o'clock. I'm just a human being who had to go and visit a strategic room. So if we have the House chair, there's nothing wrong in the House chair then taking over the reins, so that I visit that strategic room and come back and proceed with the business of the day. So I'm suggesting that hence I'm saying there is a precedence. It has happened before. But beyond this, we'll have to address it politically, so that we don't find ourselves in a situation where the House proceedings are going to be disrupted because of misunderstanding or interpretation of the proceedings. Are we agreed on that? Okay, fine. Can you proceed, Honorable Labuskachne? Oh, by the way, I promised to recognize, no. Yes, Honorable Dlamini.
Thank you very much, Honorable Chair. Standing on a point of order, this House has got rules. It would assist us if the members were referring to a rule that is speaking to this matter. Because if we say we're going to go and consider, I will raise something else tomorrow. If they have a problem with this, let them refer us to a rule in a rule book of this House.
Okay, fine. Point taken then. Chief Whip.
No, Chair, I first want to concur with...
Order, honorable members. Order. How should I call a name now again? Members, order, please.
Chair, first I want to concur with you that in applying the rules of the House, all of us need to be assisted if there is an inconsistency with regard the application of the rules of the House. That should be pointed out that there is inconsistency and therefore that should be corrected. But the point that is raised, my understanding is that members are raising it. It was raised not because there's something wrong. It was raised whether or not is it a good convention to have a member that will debate later to be presiding. So I think the point is been raised also that the House was not in a crisis. It has its House chair who fully understand and appreciate that he's guided by the rules when he's at that seat. And there was no crisis. The member has not ruled in any manner that suggests that he's biased or otherwise. So there was consistency. So I think it is important so that when we apply the rules, we should not plunge ourselves in a crisis. We should be consistent in terms of applying the rules in a manner that assists the House. Thanks.
No, thank you very much. Honorable Labuskachne.
Thank you, Honorable.
Honorable Labuskachne, can you just hold? Honorable Kony, on what point are you rising?
Ke a leboga modulasetulo. You know, Honorable Nyambi, as he was presiding over there, was wrong. He must stand up and apologize. Because if he wasn't, he wouldn't have left that seat, number one. Number two, Honorable Dlamini is claiming rules. He's the worst member in this House who always stand up without referring to any rules. So
Kony, that's
she
not
must
a
not
point of
even take
order.
us there. Thank you.
That's not a point of order, and I'm not going to sustain it. Can you continue with the debate, Honorable?
Honorable Deputy Chair, Honorable Minister, Honorable Members and fellow South Africans, the Department of Public Enterprises failed its mandate of oversight at state-owned enterprises and therefore had to adjust their priorities to curb the widespread corruption, nepotism and capturing of state-owned companies. Only time will tell if the amount of 266.7 million rand allocated for 2017 and 18 will be spent on some of the most important adjusted priorities, namely the developing of a government's shareholder oversight policy that will create systems and capacity to deepen its oversight, conclude a shareholder policy and provide a business case for government on how to phase out SOCs that are no longer relevant, and implementation of cost containment measures. We, and even some members of the ANC themselves, find it hard to believe that this department and its entities is fulfilling its purpose. Robert Morley wrote in the Trumpet of December 2013, and I quote, "South Africa is a nation in desperate need of solutions. Its people followed the Rainbow Revolution, and instead of finding a pot of treasure, they found themselves sitting in a pot filled with simmering water." Close quotation. Currently, this is not a pot with simmering water. It is a pot of boiling water. We, as South Africans, are boiling in a pot of severe economic challenges. Our struggling education system does not prepare young people efficiently to enter the workplace. Our economy is scarcely growing. About 17 million people depend on social grants, and more than 9 million people are without jobs. So what does this have to do with state-owned enterprises? In the presentation to the Select Committee, the Department of Public Enterprises stated that, and I quote, "State-owned enterprises within the Department of Public Enterprises have a combined asset value of over 1 trillion rand, and it is in key sectors of the economy. This capacity in state-owned companies can influence the direction of the economy, and this is key leverage for the department. State-owned companies have been central to keep the economy afloat." Honorable Deputy Chair, this backdrop paints state-owned companies as an important influence, not only to direct the economy, but also keep it going and growing, create jobs and develop skills. Unfortunately, this is not the picture portrayed when Moody's further downgrades included South Africa's top 5 banks,
3 development finance institutions, Eskom, AXA, and Central Sunroll credit ratings. Reasons given for this downgrading is, I quote, the weakening of the South African government's credit profile. This is in sharp contrast of what the department and its entities wants us to believe. These state-owned companies are now characterized by corruption, by corruption, nepotism, and state capture. How could the following be allowed? In spite of all the interministerial committees and all those things, it still happened. Eskom's well-known example of nepotism are Mashela Koko and Koketo Choma, where 1.7 million rand was donated from the latter's account to the ANC. Brian Molefe, the crying star of Saxon Ward, resigned or left Eskom. His 13 million rand pension not being approved by Mr. Brown, thank you very much therefore, returned to Eskom and in the end was asked to finally depart. We are still waiting for the release of the Denton report, a report containing details of widespread corruption. Brian Molefe and Ben Ngubane apparently tried to force the previous Minister of Mineral Resources to withdraw Glencore's optimum mining license in a bid to help Gupta's takeover of Glencore coal mines. Gupta leaked emails uncovered that the Guptas tried to sell Denel's intellectual property to India, acting as middleman. Fortunately, Treasury stopped the Denel Asia joint venture with Laser Asia, a Gupta-linked firm, as the Guptas arranged to sideline Denel and take the biggest share for themselves, even though it was Denel's proprietary technology that was to be sold. South Africa's forest company is still struggling with land claims on more than 60% of the land with no solution in sight. Transnet's involvement in the fraudulent Prasa locomotive deal. There is yet another new business model to improve sustainability for SA Express Air. The successful land claim that the Minister mentioned resulted in an Lexco pooling and sharing joint venture, which is relatively successful, but does not tell the story of the failure of the agriculture and marine culture. Is probably due to an ineffective deed settlement, a whole community left hopeless in fear, conflict, and poverty. We did an oversight visit there. Minister, will the department ever initiate a forensic investigation into the trust funds, processes, and procedures of the Richtersveld community? Honorable Deputy Chair, the fuel firing this boiling pot is cronyism, cadre deployment, lack of leadership, transparency, and accountability of the ANC government. The DA is instrumental in establishing an ad hoc parliamentary committee to get to the bottom of the rot on Eskom as a start. The DA is at the forefront of unbiased oversight, uncovering corruption of leaders who have been and still are channeling funds into their own pockets while millions of South Africans are living in poverty. A DA-led government will ensure that we do not stay stuck in a pot of simmering water. A DA government will encapsulate the treasure of integrity, accountability, freedom, fairness, and opportunities for all. I thank you.
Thank you very much, Honourable Member. The next Honourable Member that will continue on Councillor Stoffile.
Chairperson, Minister, and August House, we appreciate the opportunity given to us as local government sphere, because we understand that developments takes place in communities on the land that is run by municipalities. And Therefore, it's a very good interest to us as local government to participate in this debate. We cannot hope to formulate adequate development theory and policy for the majority of the world's population who suffer from underdevelopment without first learning how their past economic and social history gave rise to their present underdevelopment. So said Andrew Frank. Chairperson, it is a common knowledge that an apartheid system segregated South Africa into three kinds of social, economic, political, administrative spaces. The major urban areas, which by design created social and economic denialism, creation of vital economic farming regions and association small rural towns, and creation of economic unavailable so-called homelessness reserved for South African black labor majority. Frennon argues this, being our social and economic history, resulted in the present underdevelopment with its social, economic, and cultural indications. Deepening poverty, growing gross income inequalities compared to urban areas, and chronic unemployment. Honorable Chair, we are left with 13 years to review whether, as a country, we have achieved all our targets as reflected in the 2030 vision. While the intention is not to invite an immediate response to this pertinent question, we are of the view that at strategic level, we ought to have attempted to address important questions that will, in our view, inform deployment of resources to implement the NDP. While the list might not be exhaustive, among such questions may be bedevil us are as follows. How does South Africa build a robust, activist developmental state that intentionally deploy economic values of our state-owned entities to catalyze the economic growth to enable fundamental economic transformation? What are the important characteristics of the industrial strategy that will get South Africa to advance at the fastest rate possible? And that industrial complex, how do we create a strategic linkage between these strategic state-owned entities to work with our government, which are the engines of the economy, to ensure a whole-of-government approach to deliver a sustainable, inclusive economic growth? To what extent can we harness our fiscus through state-owned entities to stimulate investment of private capital in order to ensure a vibrant economy? What are the vital drivers in South Africa special space that will accelerate development and address all fundamental aspects of social transformation as part of nation building and social cohesion? What must we do strategically, positioning our country as a preferred destination for foreign direct investment? What must we do to encourage our big multinationals companies to invest in foreign markets but remain residents in South Africa? This question remains pertinent and requires urgent answers so that we can indeed truly become an activist state, developmental state. It is our considered view that our country needs a developmental state that must increase its instrumental involvement in the micro and micro planning and catalyst stimulation in order to grow the economy. Through state-owned entities, the developmental state should be our efficient, distributive, and allocated resources and therefore invest optimally in critical areas that are the basis of industrialization and radical economic transformation. Honorable Chair, we must prioritize construction of a harmonious social industrial complex that strike a strategic alliance between the state, labor, and industry in order to increase critical measures such as productivity, job security, industrial expansion, if radical economic transformation is to be realized. In order to realize the dream, it is vital that South Africa produces a human capital that is highly educated, innovative people who are able to conduct advanced research and development to identify important areas of growth, potential plan, and execution of the required solutions.
Councillor, can you just take a seat? On what point are you rising, Honourable Member?
Thank you very much, Chairperson. Ke ema lebaka mabapi le Speaker's List, Chairperson. Because rona ba bangwe ga re tlhaloganye gore re tlile go bua morago ga bomang because go na le di.
Come again? Can you just speak loud?
Ke ema mabapi le Speaker's List because ke bona gore ga se tsamaye the way se ntseng ka teng mo. Yaanong re beo mo dinakong gore Speaker's List se tsamaya jang ka gore
You have a different speakers list from what I have here.
yes mo go se ke se tshwereng Stofile ke number Honorable Stofile sorry ke number 10.
Okay, fine. We'll just get the updated one and distribute it.
Honorable Chair, it will be remiss of me as a representative of our local government sector not to make a few critical observations in the state of local government in relation to economic transformation. While local government in the democratic form is now more than 15 years in practice, we remain confronted by a stubborn apartheid geography. The result is that the exact stage of development which any given municipal funds itself in many different, vast from that of its neighbor. Some municipalities, despite the persisting global economic crisis and the unavailability challenges of resourcing, vast municipality areas, the aging infrastructure are already sustainable or the unsustainable phase. The predicament plight of certain parts of the Republic in terms of our past extent a favorable situation for some of these municipalities. If you allow me, Honorable Member, Chairperson, these as historical, social, and economic enclaves remains constant reminders of our past due to entrenched colonial imprints, and therefore these should remain in our terms of fundamental transformation. It is in such municipal areas, Honorable Chair, where as catalyst for social and economic transformation, state-owned entities should work with municipalities. In conclusion, Chair, we are indeed hopeful that the interministerial task team will resolve the current stalemate between the local government sector and ESCOM if we are to make any meaningful progress as envisioned in the NDP. We need a more coherent government that is not only operates as seamless, integrated machine, but also dependable partner to investors and the private sector in general, as well as, most importantly, all South Africans. Thank you very much.
Thank you very much. Honorable Nita. Just for purposes of us not getting confused, can I just call the numbers? Because whilst the office is trying, yes. After Honorable Nita, it will be Honorable Koni, it will be Honorable Kaula, Honorable Singh, Gaila, Wiley, Julius, Honorable Nyambi, and then the Minister.
Thank you.
Honorable Shabang.
Honorable Koni was quite right. If you look at page 25 there, you'll find that it is written that the officer presiding must call members in accordance with their list. Thank you.
Yes. That's exactly what I'm doing, Honorable Shabang. It's just that maybe, that is why I said to Honorable Koni that we are trying to facilitate to get an updated one, because the one that I'm looking at is titled Final Version 2, Revision 2, and I'm sure with you it's 1.
Because it has been persistently happening. Even myself, I spoke before my time, but you are repeatedly making mistakes.
Okay, point noted.
Thank you.
Thank you very much. You may proceed, Honorable Member.
Thank you very much, Honorable Chair. The Minister present, Honorable Minister Lynn Brown, the Chief Whip in absentia, Salga, Representative Councillor Stofile. Chairperson, let me first start by supporting the budget vote of the Department of Public Enterprises. And continue with my speech. The state-owned companies in South Africa emerged from a particular history characterized by structural fragmentation, incoherent governance system, leadership weaknesses, management instabilities, inadequate legislative and financing framework. These material conditions, together with a poor audit outcome for some state-owned companies, through time have also produced popular narrative that claim that SOEs are drained and a burden to the state and the South African economy. For many years, the South African-led government has argued that the SOEs serve as an important vehicle towards advancing national development objective through providing economic and social infrastructure and contribute to both economic growth and overcoming spatial inequalities. As a country, we have declared that we aspire to be a developmental state where our state should play a central role in leading the initiative aimed at achieving a decent quality of life for all. As such program, to build a democratic development state that is responsive, legitimate, capable, and accountable should therefore be intensified. Broadly speaking, the key concern in relation to SOEs is to what extent are their objective and action aligned with their broad and long-term aspirations. In this regard, it is also important that our assessment of the performance of SOEs should not only be limited to the bottom line of profit and financial sustainability, but our evaluation must fully incorporate the question of whether SOEs are responding appropriately to the transformative and developmental state agenda. For example, we acknowledge and applaud the fact that Eskom has continued to maintain a positive financial performance with the company posting a net profit of 4.6 billion in the 2015-2016 financial year, and that even in the 2016-2017 financial year, the company is projected to post a profit. However, in the same vein, the developmental entities such as Eskom, we must also inquire about the pace at which
the poor utility is driving to the completion of the electricity to some of our rural areas. The areas without electricity even today include some wards in Imzumvubu local municipality, Ndabankulu local municipality, and others in Alfred Nzo district. Colleagues will recall when we visited through our program of oversight. We acknowledge and applaud the fact that proportion of households with increase to electricity has increased from 36.2% in 1996 to 85.4% in 2016. We, however, declare that we must complete the task and deliver electricity to the places I have mentioned before. Also necessary to raise sharply as it relates to ESCOM in the blanket approach, cutting the supply of power to some defaulting municipalities. The colleague from Salga have mentioned, Honorable Minister, that the interministerial committee that is dealing with the issue must fast-track its work so that we do not find ourselves in a situation where the debt of 9 billion that we are currently having as ESCOM, it gets to be increased. So that one is very critical for us to fast-track. In this regard, it goes without saying that government and the power utility must deeply relook the situation and address socio-economic and management structural issues that underpinning factors that lead to defaulting. To municipalities, the agreement that they have signed with ESCOM, we plead with them to honor their debt service, because if they do not cooperate with that, it will be difficult for the ESCOM to be able to deal with the 32 that is unable at all to pay due a number of challenges that they face. Moreover, Chair, we consider that the long-term solution must seek to benefit from the entire South African economy. In plain language, this means our SOEs in the systematic and integrated manner must balance the trade-off between commercial and non-commercial objectives. Chairperson, ESCOM as a public entity utility of the state continue to be crucial for the long-term sustainability and generation, transmission, and distribution electricity to industrial, mining, commercial, agricultural, and residential consumers, and other distributors. In performing this mandate, ESCOM realizing of outcome 6 of the midterm strategic framework, which strive to an efficient, competitive, and responsive economic infrastructure network. ESCOM generates 96% of the electricity used in South Africa and 45% of the electricity used in Africa. The company has relatively managed to put mechanisms in place to manage the reserve margin and investment and in generating capacity and an increase in economic growth, which in turn has led to an increase in electricity demand. The challenges of maintenance backlog and a decline in power plant performance are being addressed by ESCOM. ESCOM has significantly improved its implementation of the Integrated National Electricity Program, which managed by the Department of the Energy. The company electrified 159,853 additional households in 2014-2015 and 158,016 additional households in 2015-2016. Since the inception of the Universal Access Program, the number of electrified households has increased to about 5 million. Moreover, ESCOM must acknowledge and support the role independent power
producer play in South African electricity market, especially as it relates to our commitments to the energy mix, which includes coal, renewable, nuclear gas. It is also encouraged to learn that Eskom has had an average of excess of 4,000 megawatts of electricity. On SAFCOL, pertaining to SAFCOL, the company's mandate is to ensure that sustainable management of plantation forest, increase downstream timber processing, and play a catalytic role in rural economic development and transformation. The company financial performance remain under pressure because of slow growth in the revenue and continual increase in
Honourable
costs.
Just take a seat. Honourable Kaila, on what point are you raising?
Chairperson, I'm rising up on a point of that this house, do we have a quorum in this house? Because at the moment, if you look at Northwest, Northern Cape, Gauteng, Free State, it's mainly the oppositions there. So there's no leaders of those provinces.
No.
Thank you.
Honourable Kaila, this is a policy debate that is not going to need any voting, whether it be parties or what. Thank you very much. Can we continue with the debate?
Thank you very much, Chair. We believe that situation warrants expansion through diversification of products offering and access to new markets guided by the clear growth and development plan. However, the resumption of the operation in Mozambique is important in realizing its African ambition. As a portfolio committee, we further advise SAFCOL to do more in compensating communities around their operational and work closely with communities to find amicable solution on instances regarding land under claim. The policy position.
Honourable Member, unfortunately your time has expired.
Thank you very much, Chair.
Honourable Koni. I said Honourable Koni. Okay, just take a seat for now. Yes, Honourable Member.
Honourable Chair, you might have seen that Honourable Labuskaghni wasn't very well. I've requested her to go home, so I just want to put it on record that she will not be here to listen to the other debates. Thank you.
No, I'm aware. I could also hear that she's not well.
Thank you very much, Chairperson. You can't disturb the progressive movement based on that, man. It's fine. Thank you very much, Chairperson. The EFF stands here again to warn South Africans. We want to warn the country before it is too late. We want to warn the country before the lights are out and Eskom has collapsed. We want to warn the country again before South Africa Airways flights are grounded and cannot fly anymore. We want to warn South Africans before our ports of entry for goods are closed and Transnet is nothing but a shadow of its former self. The EFF stands here to warn South Africans before Denel is no longer a state-owned entity but an entirely Gupta-owned entity. They have already started taking it piece by piece, and the corrupt joint venture between Denel and 21-year-old Atul Gupta nephew is just the beginning. As the EFF, we have questioned the existence of this department, and correctly illustrated why it should not exist. But let's deal with the nonsensical state of affairs or circus at the state-owned entities. We now have undisputable and hard cold facts that indeed the Guptas have captured our SOEs and they are in the driving seat. They decide and appoint board members. They decide who must be appointed CEO and CFO. They decide which tenders must be issued, when and how, and to who. This is as a result, has not only rendered this department useless and unnecessary and irrelevant, but as a country, our state-owned entities are missing an opportunity to play a developmental role build infrastructure in a cost-efficient and affordable manner. Now, we stand here as the EFF providing clear guidance as to what must be done going forward. Number one, because the appointment of all current boards are very questionable and corrupt, we must dissolve all boards of SOEs reporting to the Minister of Public Enterprise. They must all be fired. Number two, we must appoint interim boards that will stabilize governance and management of these SOEs and not be allowed to approve any major tenders until a new board is appointed. But at a much more strategical level, we call for dissolution of the Department of Public Enterprise because we now know that this department is just a rubber stamp, failed to do proper oversight and does not have capacity to make strategic input into the mandate of SOEs. All entities that fall under the department must be moved to line function department. SAA and Transnet must go to transport. ESCOM must go to energy, and all other entities to the respective line function departments. And let's do away with this nonsense once and for all and save South Africa. I am very happy that the minister also agrees with me that there is crisis within these departments. In those few words, the EFF will reject this budget vote. Thank you.
Thank you very much. Honorable Kaula.
Honorable Chairperson, Honorable Minister, the IFP has repeatedly stated in all debate around this department that this is one department in the country that should never be. All the state-owned enterprises administered by this department should have long been transferred back to their line function departments. In the State of the Nation address in 2016 February, this is what the President said about the state-owned companies, and I quote, "Compatriots, we have heard the concerns raised about the performance of the state-owned enterprises and companies. For the state-owned companies to contribute successful implementation of the National Development Plan, they must be financially sound. They must be properly governed and managed. We have to streamline and sharpen the mandates of the companies and ensure that where there are overlaps in the mandates, there is immediate rationalization. Those companies that are no longer relevant to our development agenda will be phased out." Close quote. Unfortunately, as usual, this has become another empty promise, empty commitment. Instead, the country has experienced one scandal after the other on our state-owned companies. We have recently experienced drama unfolding at ESCOM. A CEO jumps ship after bragging about frequenting a non-existing ship in at Saxonweld. He becomes a member of parliament for 1.5 months. When he realizes that he has missed appointment to the cabinet in the midnight cabinet reshuffle, he shifts back to what he claims is his position at ESCOM. The ESCOM captured board under the disappointing chairpersonship of Dr. Ben Ngubane tries to console him by offering him 30 million rand of taxpayers' money. Thanks, Minister, for stopping it. He also claims that whilst he was earning a salary as a member of parliament, he was at the same time on some kind of special leave at ESCOM. What a drama. This qualifies for the real Mickey Mouse administration. Now the board's chairperson has also jumped ship. Whether Brian Molefe and Ben Ngubane jump ship or boat or kite, they must still be brought to account about the billions gifted to the Guptas and their friends at ESCOM. The law must take its course. It is alleged that another acting ESCOM CEO, Colin Majila, in 2014, also had his CV passed via the Guptas before getting his job, whereafter the Guptas started collecting through him for the services rendered. We have recently heard about how the Guptas and their associates have scored about 3.5 billion in locomotive kickbacks at Transnet. We have heard about a Dinel director, Dan Mancha, getting chauffeured around Dubai by a Gupta arrangement in return for services. How a deluxe suite for Matsela Koko was arranged at the luxurious Oberoi Hotel in Dubai, and how he subsequently got appointed as acting CEO at ESCOM. We have heard that a Rajesh Naitani was dumped as SAA board member in October 2014, he sent an email to Chawla asking him to tell Tony Gupta to get me at Transnet. The stories of corruption, capture, mismanagement, and maladministration continue on and on with no end on sight. Every new scandal in this country has an SOE or SOC on it. Maybe it was a blessing in disguise that the president's supposed rationalization became another pie in the sky, so that when these stories get out of the closet, the SOEs and all those involved are still in front of our eyes. The state-owned companies have been fleecing and milking the country's coffers without bringing any material value to the national fiscus. It is only now that one can understand why what was happening has been happening. When appearing before the ad hoc committee that investigated the SABC, the previous board chairperson and his previous predecessor both claimed
Honourable
that...
member, your time is expired.
Oh, my God. I thank you, Chair. There are more stories I wanted to relate to you, Minister. Thank you,
Honourable
Chair.
Singh, can you continue the debate?
Thank you, Honourable Chairperson. The Honourable Minister of Public Enterprises, Honourable Lynn Brown, the Chairperson of the Select Committee, Ellen Prince. Chairperson, the ANC supports Vote 9, Public Enterprises. In saying that, this year we honour one of our greatest stalwarts of our movement, Comrade Oliver Reginald Tambo. It is befitting, therefore, that we dedicate our collective efforts even more in realizing our vision for South Africa. Black and white shall live and work together as equals in conditions of peace and prosperity. The Chairperson, transformation of South Africa's economy will be achieved once all South Africans share in the wealth beneath our soil. We welcome, Chairperson, a few weeks ago at the World Economic Forum on Africa's Transnet revealed the taste of opportunities that existed in this continent, when they invited representatives of companies that they have been dealing with in 8 countries to join them on a tour of the port of Durban. Transnet is currently negotiating to develop port, rail lines, pipeline infrastructure in Senegal, Liberia, Ghana, Togo, Benin, Nigeria, Democratic Republic of Congo, and Kenya. These efforts can only benefit the province and South Africa as a whole. Mr. Chairperson, this year the ruling party is holding its policy conference. It does so in the context of the social economic environment characterized by extreme levels of inequality, poverty, and unemployment. The ANC would like to turn the wealth of the people to the people of this country. We mean fundamental change in the structure, system, institutions, and patterns of ownership, management, and control of the economy in favor of all South Africans, especially the poor. State-owned companies have been given the marching orders to deliver on their mandates. And we welcome state-owned companies that have taken massive infrastructure and job creation projects. We need our black-owned companies to supply state-owned companies that we are not supplying by black-owned, empowered companies. Chairperson, it is enormous scope to transform the profile of suppliers, bringing in new companies and convince owners of existing companies to enter into profit-sharing arrangement with workers, amongst other measures. Chairperson, short-term challenges is to confront and overcome the cloud of allegations and counter-allegations related to corruption in state-owned companies, and is set about our transformative journey in a climate of the highest ethics and responsibility quickly and thus contributing to the rating agencies reversing the recent decisions in the shortest possible time. We need to improve the performance of state-owned companies and gain public confidence. Transnet has partnered with Design Institute of South African Bureau of Standards, SABS, to establish the Transnet Innovation and Design Research Center. This partnership promotes a culture of innovation and partnership we invited to. Through its moving ideas concepts, more than 1,200 young entrepreneurs were invited to submit life-changing and innovative ideas that would involve solutions to challenges in their communities and some of Transnet's operational challenges. We welcome between the 6 state-owned companies in this portfolio, we've enrolled 8,991 trainees as the 31st of December 2016 in various scarce skill jobs and critical skills program, and a total of 10,655 trainees in various disciplines graduated with a variety of programs over the past year. 607 of whom have been employed, and 1,779 learners have received bursaries for the current year. Chairperson, this is a good story to tell. A solution must be found by government on how to assist municipalities where there is virtually no income generation based on those municipalities resorting to using funds and payment of electricity for their daily operations. The current negative economic growth, both national and international, necessitate that Transnet reverse the targets of its complex investment program. The strategy to revitalize branch lines to support its road to rail strategy is gaining traction, with Transnet's board approving 3 branch line transactions. This exchange will definitely save our roads from the damage that's caused by heavy vehicles that take goods on our roads. The company delivered 37 passenger coaches engineered and manufactured at its Center of Excellence in Pretoria and Cape Town, and to Botswana Rails. The successful delivery confirms the strides that Transnet division has taken as it aggressively advances towards becoming South Africa's leading manufacturer of rolling stock. Chairperson, in addition, the development of the Trans-Africa locomotive, the first diesel locomotive designed and built in Africa for African conditions, aligns directly with the Transnet Africa strategy and the company's vision to become the leading provider of logistics services in sub-Saharan Africa. Mr. Chairman, we patiently wait for the company to announce profits in the 2016-2017 financial year. SAFCO is expected to report positive financial results in this financial year. I want to turn to Alexco, Mr. Chairperson. During this current financial year, the department completed a desktop study on the Richtersveld diamond deposit. The study confirmed it is possible to extend the life of the Alexco pooling and sharing joint venture beyond its current estimated 10-year lifespan. Alexco experienced operational challenges during the 2016-2017 financial year. It did not meet its carriage production set for the year under review. However, its diamond revenue increased from 386.5 million in 2015-2016 to 758 million in 2016-2017. Chairperson, we welcome the Department of Public Enterprises establishing its terms of its own enabling legislation, which sets out the purpose, mandate, and objectives for which they have been founded. All these state-owned companies are incorporated as companies in accordance with provisions of the Companies Act 2008. The responsibilities of the ministry and the department are to ensure effective shareholder oversight and these state-owned companies by ensuring continuous alignment between shareholders, strategic intent, and the objective of the state-owned companies. The objective of the department
Member
are
Singh, can you just take a seat, Honorable Koni? What point are you raising?
Ke a leboga modulasetulo, ke kopa gore o ntlhotlhomisetse le member mo podium gore a ka tsaya potso.
Honorable Singh, are you prepared to take a question?
no, I don't have much time.
No, he's not.
41 seconds left. Chairperson, the department are to ensure effective shareholder oversight for these state-owned companies by ensuring continuous alignment between shareholders and strategic intent of the objectives of the state-owned companies. The objective of the departments are, through state-owned companies, to meet South Africa's goal of reducing unemployment, fighting poverty, ensuring that the economy grows, and the objectives of the National Development Plan are met. The challenges, however, is to achieve this without the hindrance of private or public sector corruption. The Ministry and the department further has a duty supporting the state-owned companies to deliver on their
Honourable
shareholder
Member, I'm
impacts
afraid your time has expired.
and corporate plans. We
Time has
support
expired.
this vote. I thank you.
Very much. Honorable Taylor.
Thank you, Honorable Chairperson. Honorable Chairperson, state-owned enterprises are supposed to be instrumental in South African economy as vehicles to support economic development. In 2015 alone, SOEs made infrastructure investment to the tune of 160 billion in South African economy, which is up from a mere 25 billion in 2005. It is, however, important to note that Eskom, Transnet, and Transnet account for more than 56%, about 90 billion of the 160 billion invested in infrastructure by SOEs in 2015. Chairperson, you are aware that most of our SOEs have over the years experienced major governance failures due to weak accountability, over-bureaucratization, excessive politicization, and unclear objectives. It is common knowledge that South African SOEs absorb substantial amount of resources and actually impose a heavy burden on the fiscus. For proof, one is to look no further than Eskom and SAE and South African Airways, to mention but a few, and PRASA and others. Those challenges occur despite government initiating a comprehensive review of state-owned enterprises in 2012. There is also a challenge where ANC cadres who could not be deployed in parliament or in executive are dumped in these SOEs. Otherwise, how else do you explain the promotion of Dr. Ben Kubane from SAPC to Eskom when he is responsible for the mess in which SAPC finds itself? We are not impressed by this improper resignation, and we think that he can't use resignation to escape accountability. Chairperson, during President Mandela's era, state-owned SOEs were doing well. SAA was in time. Today, SAA's flights sometimes are delayed over 2 hours because of lack of governance. Eskom is in a mess up. Chairperson, this country, as long as it's run through the Guptas, it will always be a mess up. We're in a mess up because of the government that's not run properly. whereby people from other countries come and run our country. That's why we're in this mess up here. For this reason and the fact that 23 years in democracy, the government is still failing to structure and position business entities to be the strategic anchor of fundamental economic transformation. Chairperson, you cannot go far with ESCOM as well. You find that electricity is only in the main, near the N2, which is quite true. In my village, for your information, there's been no electricity. In many other villages, Chairperson, for this reason, the UDM does not support this budget because we feel that this department was not supposed to be there. These entities are supposed to be under their own departments. As a UDM, we do not support this department. These state-owned companies must be run properly. I thank you.
Thank you very much, Honorable Wiley, Chief Whip, Western Cape.
Ja, seker. Voorsitter, baie dankie vir die geleentheid. Chairperson, thank you very much for this opportunity to address you today. I must admit this minister must have one of the most unenviable tasks in this government. Her task is to try and ensure good governance and prevent the looting of the country's SOEs, also known as public entities. It's an uphill battle for sure, and we've heard some of the tales already. I don't know whether the members know, but there are 9 Schedule I constitutional institutions, 21 major public entities, 154 other national entities, and 22 business enterprises in the South African dispensation. But this minister deals with only a portion of these, and she referred to them in her speech. But it's still a big job requiring competent managers, and the minister said it requires good managers. Unfortunately, it is not so in reality, despite the rosy picture that the minister has painted. And we have already heard from various speakers as to some of the problems that we know about, and I would like to allude to one or two of them. Because they talked about in generalities. I want to speak about one of our Chapter 9 institution authorities, the Auditor General of South Africa. Kimi Mokwetu, the Auditor General of South Africa, stated in his 2016 report that the irregular expenditure of 46 billion rand, which was an increase of 80% of irregular expenditure from the previous year in all government departments, and a substantial amount of this was in public entities. So, in the world of Donald Trump, where he is the only person who is the owner of the truth, when everybody else thinks something different, which truth prevails here? And when we heard the minister, she talked about radical economic transformation, but her chairperson of the committee talked about the National Development Plan. Which truth prevails? This schematic over here shows how the Auditor General's report card looks for the Western Cape. You'll notice just about everything is green. I tried to print the Auditor General's schematic report on the SOEs, but I'm afraid I ran out of red ink. In fact, we have already heard the financial collapse or the crisis of almost every state-owned entity in South Africa comes as a direct result of a failure at national level to adequately manage the nation's public enterprises, or to admit that it actually has a problem. One only need look at the continuous multi-billion rand bailouts required for South African Airways, amongst others, at the helm of the incompetent Dudu Myeni in the past year. Do you know that to date, South African Airways has received government bailouts to an amount of 14 billion rand? Under Dudu Myeni's leadership, South African Airways has lost some 10 billion rand. The Finance Minister, Malusi Gugaba, has mentioned that the Public Investment Corporation, also an SOE, may be used as an equity partner to bail out SAA, effectively using state pensions to pay for the SOE failures. I wonder how many of the parliamentary staff would be prepared to use their pension money to underwrite these failures after witnessing the main actors perform in their midst on a day-to-day basis. This same Dudu Myeni also booked and paid for 23 international trips using funds for the Mthlatsi Melatuzi Water Board, which is an SOE, of which she is the chairperson. To whom does she actually owe her allegiance? The South African Airways or the Water Board? And who on earth has the time to spend 23 trips overseas? Eskom, we've heard about already. A leaked confidential internal memo from Eskom reveals gross mismanagement of funds during the procurement of capital and management of coal supplies. The minister has said that the users are down. The user group is down. And the question is, why is the user group down? It's one of two reasons, and I already spoke about this to the Minister of Energy at a previous debate. And that is either that there is a truth in the downturn of our economy, which we know, because the rating agency has already indicated that as well, and we know there is a massive increase in unemployment, or alternatively, there has been a migration away from the formal grid system to people going for alternative energies. And so therefore the operating profit is going to be down. We did make an operating profit, but we are designed to make an operating profit because we have to bank as much money as possible, because providing energy, the infrastructure for energy, is a massively expensive exercise. So the question I asked for the minister, our operating profit, is it above target or below target? The contract for coal supplies is directly linked to the Gupta-owned Tegeta Exploration and Resources, which scored coal supplies contracts from Eskom amounting to 4 billion rand, and this is well known. Now the question that I need to ask in the radical economic transformation picture, are they considered to be blacks or are they considered to be something else? Eskom has essentially been completely captured by the Zuma clan, and the Guptas facilitated through Brian Molefe and Malusi Gigaba. Does the minister agree or discuss or dismiss the state of capture report? Does the minister agree in the acceleration of the renewables program? If she does, why has the bid for window been stalled and not signed off? As far as PRAS is concerned, and that's very relevant to us here in the Western Cape because we're getting less and less trains by the day to get the commuters back to work and away from work. Day before last, they had to stand for 5-6 hours at Cape Town Station because the infrastructure had broken down. The Auditor General notes that 13.9 billion rand of irregular expenditure for 2016 in this parastatal, and it was acknowledged by CEO Letsalo. Following a report released by the then Public Protector Thuli Madonsela in 2015, it was revealed that the tender irregularities of PRASA amounting to 2 billion rand is a misappropriated funds, and called for a forensic investigation of all PRASA contracts and tenders. Had she done so, she would have discovered where a large chunk of this money went to, when recently released emails showed the Guptas got a 20% commission on the sale of the locomotives that translates into billions of rands. The Western Cape commuter rail system run by Metro Rail really could have done with that money, and the long-suffering commuters trying to get to work are now taking their frustration out on the rolling stock. If government was genuine about jobs and security, they would transfer Metro Rail to the city of Cape Town so that a proper service could be offered to the general public. Just this year, PRASA's acting CEO, Collins Leswalo, was dismissed after having said he was entitled to a 5.9 million rand salary. Former PRASA board chairperson Popo Molefe has launched an urgent court challenge to nullify the dissolution of the board by National Minister Tupoa Peters after experiencing a loss of 13.9 million rand, as I already mentioned, as a result of financial mismanagement. But chairperson, it is another area of SOEs that I want to raise with the minister, and she also touched on it, and that's namely Denel and Arms Corps. And my colleague also has referred to it. It is no secret that the arms trade worldwide is not the most wholesome industry, and kickbacks are legend. Probably the most profitable after nuclear deals. I must ask the minister, does she support a new nuclear build program? The one that is going to cost us 80 billion rand a year to finance and another 54 billion rand a year to maintain. And South Africa, with a proud record of firsts in the development of wide and diverse arms products, has recently turned the corner and become profitable again. Well done to Armscor. It was only a matter of time, however, before the Guptas turned their sights on this lucrative and secretive industry. So much goes on under the cover of national security, just their sort of world. Now it is common knowledge that my colleague in the National Assembly, Ms. Mazzoni, has repeatedly warned of the dodgy deal done by Denel and Laser VR, which own 64% via a Gupta associate. And the minister has already referred to this particular deal. The registration of Denel Asia is very questionable, and one would ask whether it in fact transgresses national security. Treasury and the Portfolio Committee were so alarmed by the irregular nature of this deal that they summoned them to explain, but Denel ducked and dived and avoided interrogation. So Treasury threatened to take legal action at the end of last year and issued legal letters. And this is the matter that the minister refers to that is going to be resolved. And one wonders how it is going to be resolved. And then the minister was fired, the finance minister was fired after he put pressure on this particular aspect.
Unfortunately, your time has expired.
Thank you very much.
Honorable Julius. Monitor your clock. And please monitor the clock.
Chair, I'm coming with a warning also. Deputy Chairperson, members, and South Africans at large, the mandate of state-owned companies to grow the economy and help to create jobs couldn't be more overemphasized more in these difficult times. And the ANC today didn't even condemn corruption and state capture. You don't care about South Africans and job creation. Rating agencies are mainly concerned about the effectiveness of state-owned companies. State-owned companies have the ability to grow the economy and provide the much-needed jobs that ordinary South Africans so need. I'm happy to see that Finance Minister Gigaba agree with this extremely important role of SOEs. But it's the very same minister that started selling our SOEs to the Gupta family when I was still minister of this department. However, corruption, greed, double-dealing, fraud, abuse of state resources, absence of moral and ethical leadership are some of the words and phrases that are used lately to describe SOEs, Minister. The very department that must change our people's lives is used by the ANC to corruptly create wealth for themselves and individuals that advance their own interest. Minister, the Gupta-linked emails show that they have misled South Africans when they claimed that the Gupta family had no interest in VR laser. Now, we heard from Honorable Lagbeskagni and Honorable Wiley, respectively, about the VR laser and the NEL Asia. But furthermore, Minister, in 2015, you facilitated the Gupta enhancing changes to the NEL's non-executive board. Under your instructions, we saw the appointment of the Gupta beneficiary, Mr. Motseki, and the removing of experienced directors for the relatively unknown directors. You appointed Mancha as the chairperson of the NEL, although he was struck of the role as an attorney in 27 already, another Gupta-linked person. These facts now begs the question, Minister, did you participate in the state capture project of the Guptas, or were you also misled in believing that all these appointments were honest? From where I'm standing, Minister, it looks like you aided the attempted takeover of the NEL by the Gupta families. Even in the interministerial task teams, the investigations, inquiries of all that, I don't trust it, Minister. Obviously, honestly, I don't trust it. I don't know who's fooling who here. Chairperson, the problem of corruption in South Africa is endemic. It is deeply rooted in all government departments, local government, especially SOEs, SOCs, where the ANC is in charge. The only way to get rid of this widespread corruption and state capture is for the ANC to be rooted out in all these spheres of government so that we can investigate who's liable for this corruption and charge them like we do now in Johannesburg, Tshwane, Nelson Mandela Bay and other areas. Honorable Connie and Honorable Kaula, I agree with you that we must get SOEs to work for our people. But giving it to line departments, I'm doubtful about that. Just look at PRASA. It's under government department transport, but corrupt. We cannot keep changing to avoid the elephant in the room. The only solution to get rid of the ANC in this government, to get rid of corruption in SOEs, is to get rid of the ANC, period. Honorable Singh, you know, singing for your supper to a highly corrupt and captured department leaves me with only one thought. Indeed, you are an ANC member and proudly so. You know, outside, you fight amongst each other over state capture, but in Parliament, you defend it today. Talk about double standards, politics of the stomach. Chairperson, the 19.9% increase requested by ESCOM for 2018-19 is a huge problem. What can possibly, Minister, justify this increase? Electricity cost is so very high in this country. It will share jobs in the economy. People are already suffering. They cannot buy electricity. They cannot do it. And 90.9% increase for next year is totally unacceptable. The only way to get rid or to get South Africa right is for South Africans in 2019 to go to the ballot box and vote out the ANC. It's the only way we can get rid of corruption, period. I thank you.
Honorable Nyambi, can you continue with the debate?
Honorable Deputy Chairperson, Honorable Minister, Honorable Members, ladies and gentlemen.
Honorable Nyambi, can you take your seat? Yes, Honorable Nikalakis.
Thank you, Deputy Chairperson. Just on a point of clarity, I'd just like to inquire whether Honorable Nyambe is standing there in his capacity as a presiding officer or as a member, or as taking part in the debate.
No, that's not a point of order. You don't need to respond to that.
Thanks, Deputy Chairperson. You know, if you have got a short memory, you'll even forget that yesterday I was presiding and I participated in that debate. Not last year, yesterday. I'm talking about yesterday.
Honorable Nyambi, may I hear what Honorable Kone wants to say?
Ke a leboga modulasetulo. Ke utlwa gore member mo podiumeng e re isa kgakala and maabane re debate a very crucial issue of land. So it's not gore ga ra utlwa gore ga ra bona gore go diragetseng. We were not paying too much attention because we thought you are to be trusted since
What point are you raising, Honorable Member?
of order.
Can you raise your point of order?
Of order, yeah. Point of order. I'm still there.
Don't make a statement. Don't debate.
Yeah. No, give me
Give me
a
the
chance.
point of order.
I'm a slow speaker, so you know you must be very patient with me. It's not like I'm speaking, I'm debating or I'm delivering a speech. I'm a slow speaker, so please bear with me, Chairperson. Kiar, ga se gore ga ra lemoga gore go diragetse mabane. Lebaka ke gore re debate a very crucial issue of land. So re nagantse gore lo a tshepega jaaka lo le mo ditilong tse le mo go tsone gore lo tla tsamisa
Honorable Member, can you take your seat? Because now you are casting aspersions. And that's exactly the kind of thing that I started to do when we started this
every
session
time
this
is
morning.
the very same thing that I started saying when I started this house.
Can
You
you
said
take-
those things because I was not in the house.
Can you-
I
can
went
you-
to the bathroom.
can you
So you
take your
did it
seat?
deliberately by saying them in my absence.
Can you take your seat, Honorable Member? Can you continue with the debate?
Let me, from the onset, indicate that, Honorable Minister, we support budget vote 9. My speech, it's a dedication to the committed, dedicated officials of ordinary people of ISCOM that is making it possible even for myself to have this electricity here. In Siswati sithi uma mntwana amoshile akathi uma sebhavini uthathe leli bhavu nalamandi ucitse. Uthatha umntwana umhlobise umbeke eceleni ubese ucitha lokusemandi lasebhavini. Honorable
What's the point of order, honorable member?
The honorable member on the podium is addressing this house, but he's directly looking at me. And no, give me a chance.
Yeah.
Chairperson,
Yeah.
it's not a secret that I've been referred to as a child in this house.
No,
And
no,
it
no.
must, no, patience if it's.
No, I never
And
heard
it's not
him
a
saying.
joke.
No, honorable member, no,
And
no.
it's very
no,
serious.
don't make a joke out
I'm
of
a
it there.
wife who was lowballed.
Honorable member, can you take your seat? Honorable member, can you take your seat? No, I'm saying honorable member, can you take your seat? No, I never said, go and check Hansard. Go and check Hansard.
I'm not going out, I'm here to.
uma ngidedicate speech sami kulabantu labakhuthele labasebentako ngicela kusho ukuthi Honorable Minister, I heard you when you said there are reports that are going to be referred to the SIU, and Honorable Julius, as ANC, will continue fighting corruption and will expose corruption. Honorable Minister,
Honorable Nyambi, can you just take your seat? Honorable Chabam, can you stand up? May I address you? Can you withdraw the word that the member is telling lies in the House? No, can you withdraw that? Because it is unparliamentary. I'm saying, honorable member, it is unparliamentary to refer to another member as a liar. Honorable member, are you refusing to do what I'm requesting you to do?
I'm not refusing his life.
No, can you then withdraw? I'm ordering you to withdraw for referring to a member as a liar.
For the sake of continuity, I withdraw.
Honorable Minister, I am from Pumalanga. So on behalf of the people of Nkomazi municipality, they are very grateful for what happened last year. The Honorable former Deputy Minister Makwanish led ISCOM, TENEL, SAA, officials to come and SAFCOL to come and share with students of that particular part of South Africa about opportunities that are available in terms of bursaries and what they can do in those entities. So it means in future we're going to be having people that will come out of that arrangement. So it was a very good thing. The problem when you have us as NCOP when you are here, what was good about our committee, Honorable Minister, is that we had an opportunity to visit Medupi, Gusile, Transnet. And that assisted us to have a better sense and appreciate what is going on. And beyond that, it made us, when we're doing a program of the NCOP that is called a provincial week, as provincial delegates from Mpumalanga province, we decided to go to Gusile so that we can understand what's going on. And we commended to see a number of very many young people that are working. We're talking about more than 15,000 people at a site that are working at Mutupi. You know, when you were here, honorable members, Honorable Minister, what do you want to raise as a committee that you think you have to attend is for us to have a sense of the social corporate investment in terms of spread so that we can have a sense, because this is the house that is representing the interest of provinces. So it will give us a better picture to understand what is happening in our provinces about those that are benefiting out of that. The second thing is that the high turnover in SOE is something that will always be a concern to us because it's robbing us senior leaders or managers. And that it's robbing when it comes to the issue of institutional memory and the efforts to implement plans that will yield the fruition we're looking for. We are aware about the triple challenge of poverty, inequality, and unemployment. But Honorable Julius, maybe it's high time that we expose the double standard that you always do when you come here. Let's use the recent example of Honorable Zille. What she did. Nothing that no one from Democratic Alliance condemned what was done by Honorable Zille here. But we are quick to talk about ANC matters. The irony of it, the hypocrisy of it, that is making even a mockery of your own party. You are saying the person is not fit to lead the party, but yet we are talking of high moral ground. It's fit that person to be the leader of government. Cease Democratic Alliance. When, you know, why I'm saying sometimes you don't even understand what we are talking about. You just come here and, you know, in this house, we don't have a person in this house that can claim to be older than ISCOM. Yet it's the ANC government that made it possible for us to have a meaningful percentage of people benefiting out of the electrification program. And we are not giving credit to that. Honorable Prince, the chairperson of the Slate Committee, even gave you the statistics, and the minister has done that eloquently, so I won't repeat that. Maybe as somebody who knows a little bit of mathematics, I will tell you what you represent. I know mathematics. You represent a formula. It's called ego is equals to 1 divided by knowledge. You know what is the answer of that formula? Let me explain the formula. The formula is ego is equals to 1 divided by knowledge. You know what does it stand for? The more the knowledge, the lesser the ego. The lesser the knowledge, the more the ego. That's what you represent when you are here.
Honorable Nyambi. Yes, Honorable Julius, on what point are you rising?
Point of order, Deputy Chairperson, the speaker on the podium is casting aspersions on my character, saying that he's saying I'm stupid. I don't have knowledge.
No.
Can you rule on that? Because I can equally call him a stupid because he sat there knowing that he cannot sit there and he took his chances. I can equally say he's a stupid.
Honorable Member Julius,
because
can you take a seat? The reality of the matter is that seated here, I never heard the member saying the member is stupid. I never heard the member using the word stupid. I heard him using a formula as a way of expression. Thank you very much. Can you continue, Honorable Member?
Tata Mandela told us that
Honorable Nyambi? Yes, Honorable Wiley, on what are you
according
standing?
instructed by you.
I don't want to waste the speaker's time, but I'm a bit confused.
Honorable
Could he-
Nyambi? Can you take your seat? Can I hear?
And deal with this white supremacists. I can't be undermined by this man.
No, can you just take
I
your
can't be
seat?
undermined
The
by you.
Honourable Speaker,
Can
please tell us which
Honourable
language
Nyambi.
ego comes from.
Honorable Nyambi, can you take your seat? Okay, he's withdrawing. Honorable Julius. Honorable Nyambi. Order, members. Order. Can I recognize Honorable Julius? Order, honorable members. Honorable Quimby. Order. Okay. Can I get the point?
Thank you, Deputy Chair. Is it parliamentary for the speaker on the podium to call the race on another member saying, I cannot be held by this white supremacist? And this time, I know you heard it because he spoke to you. This time, I know you heard it because he spoke to you.
No, let me tell you now, I didn't hear it. I did not hear it. No, you see, that is the problem. That is the problem I tried to address earlier on when we started. Because of the kind of demeanor, it is, Honorable Julius, I'm just happy that you're not on record. Honorable Nyambi, can you continue the debate? Honorable Manopole.
Thank you, Chair. I'm just making a request, and because of this, it has been consistent of Honorable Hatton, what he has been doing. Honorable Nyambi, he's not the first one to be subjected to. Really, there's this undertone of racist undertone and white supremacy. By instructing, actually he's undermining you. By first instructing the member on the podium to take a seat in the tone that he has raised. And it's been consistent, yes.
To do what?
To instruct the member to take a seat. Yes.
Okay, fine. I didn't hear that.
So I'm just,
yeah.
hence, Honorable Nyambi didn't take a seat.
Was it on record?
Yes, no, I'm not sure it was not on record.
Okay, fine.
In a very racist manner.
Honorable Chair, can you please be alert of this? This is not the first time that he's doing it.
Can I satisfy myself by checking answered and then make a ruling on that? Honorable members, can you see what you're doing? Can you see what you're doing? Honorable Mpambo Sibugwan.
Ndiyabulela mhlali ngaphambili sekela mhlali ngaphambili mhlali ngaphambili into enzacela enozisa uxolo kuyo yonke lento ukuba sifumane ikopi kaHansard ngoba simvile uHonorable Nyambi esitsho ndiyamangala Honorable Chairperson into yokuba ungathi esecaleni kwakho kangaka ungamva kodwa umuntu le kude ufana noShabangu ukwazi umva kodwa ke uHansard uzawuzisa into yokuba kubekho uxolo kule ngxoba kaxaka ndiyabulela.
Thank you very much, because one of the problems, that is why I'm calling to order. You see now, you become rowdy, and then when you become rowdy, and then I ask you to be in order, you are not in order, and you expect me to hear everything. By the time Honorable Chabangu made that statement, it was quiet in the House. That's why I could pick him up. But once you are rowdy and behaving as if you are not honorable members, I mean, obviously, I won't be able to hear. Honorable Nikolakis. Honorable Chabangu, can you take your seat, please? Because I'm recognizing Honorable Mikalakis. Let me recognize Honorable Mikalakis.
Thank you, Deputy Chairperson. Deputy Chairperson, to stand up on a point of order and to say that a member is disruptive or that his comments are condescending or what have you, that is one thing. But for a member to, without any foundation or grounds, to accuse another member of being a racist without a racist utterance being made, I think it is a very serious accusation. And I would like you to request the Honorable Manopole, because there was no racist comment.
Honorable member.
To withdraw her comments and her accusations that our member was
Honorable
racist.
Mikalakis,
We
I
can't
think,
go
I'm
about
sure,
calling each other racists.
I'm sure you'll bear with me, because I checked whether was the mic on. There was no certainty. And I said, I will check Hansard and satisfy myself whether, because it was an accusation of something that was said by somebody else.
Please, Deputy
Thank you very
Chairperson,
much.
I appeal to you because it seems to become a tendency that when there is no political debate left, that the ANC resorts to calling the
Honorable
race
member,
card.
I've made a ruling on the matter. Can you please take your seat? Can you continue the debate, Honorable Nyambi?
Tata Mandela taught us, Honorable Deputy Chairperson.
Honorable Nyambi, can I take Honorable Chabangu?
Deputy Chairperson, let me speak Sotho, maybe you'll understand.
You see now, you are busy arguing now. You are busy arguing. Can you please just be in order, honorable members? Yes, Honorable Chabangu.
Yeah, khuluma isizotho manje. Wabona this thing etsahalang ka mo. Kore wena o deteriorate this house because we ketse ka reng ha o utlwe ditsebeng. Ha o bua batho ba ANC ha o utlwe, ha o bua rona wa utlwe. O batla o re ntshetsa ka ntle. And then if at all o re batla o re ntshetsa ka ntle, now I'm not afraid to go out. Even if to be called by the bouncers, I can fight.
Honorable Chabangu, that's not a point of order. I don't know what informs that statement. Therefore, I'm not going to recognize what you said. Honorable Nyambi, can you continue?
Honorable members, many a times in this podium, an impression is created that the issue of the public protector is something that was not created by the African National Congress. And it's even worse because even Advocate Thuli Madonsela was appointed by the government of the African National Congress. So it's a clear indication that we will fight corruption. We are not representing anything that has to do with corruption. I was tempted not to respond, but to go through what I've prepared. But after thinking of what Tata Mandela told us, open quote, fools multiply when wise men are silent, close quote. So it is out of that reason that I will be doing a disservice to Tata Mandela, Honorable Minister, because the double standard that we see every day, if you'll allow me, Chairperson, to share with you a very short story of a boy that immediately when we got to democracy was called by somebody who employed this boy, and the employer told this boy that for now, moving forward, I'm going to do three things. The first one, because we're getting to democracy, it's a true story. Because I used to be boss, I'm no longer going to be boss, we are going to call my name. The second thing, the boy used to be at the back, and the dog used to be in front. Then the man said, no, now, moving forward, we are no longer going to be at the back, we are going to be in front. Then the last thing that is very important, should it happen that by mistake, because I was used to calling you kafir, should I say kafir, then I'm going to fine you 2,000 rand. Then when they were driving to town one day, they got a puncher. When they got a puncher, the man was in front, because they told him three things. The man was in front, the man got out, he said, no, what are we going to do? The boy said, no, you are going to hike and go to the farms and get 9 kaffers to come and assist us with the puncher. What is the morality of the story? According to the boy called Matume, you were supposed to have kaffers, but he was supposed to be the only one that was supposed to graduate. So many a times here, I see that mentality. That is why I'm posing it as a challenge to a whole range of you to ask yourself whether are you not representing Matume when we are here, who are supporting this budget vote. Thank you, Honorable.
Thank you very much, Minister. Can you conclude the debate?
Chairperson, thank you very much. Let me take the fools multiply when wise men remain silent. You know, I am saying here and now again, the ANC will deal with the allegations of corruption in the following ways. The one is, in my department, I have the SIU that will investigate ESCOM, but I'll tell you what I want to do. It's all the procurement practices of ESCOM across the board, and then I want to investigate something else as well. And you know, I read a very interesting book by Henny van Vieren called Apartheid, Guns and Money. And it speaks about how it kept the machinery, it just came out recently, the machinery of apartheid going. And in that book it mentions ESCOM, Spoornet, which is the old Transnet, and I want to see whether the patterns are the same. We know that the Post Bank, the Post Office, ESCOM, Transnet, all of these companies were used in the past to build white capital. And we know that today, as I stand here, that in a company, I can prove it. Let me say it to you now. I'll tell you that in ESCOM, we spend 50 billion rand on coal annually. Now, there are 4 white companies that get 73% of the 50 billion rand. And I am saying to you now that they have had contracts for 40 years, 23 years our time, and 17 before that. Their contracts come to an end in 2020. And that is what the battle is about. But having said that, 26%, 73%, 27% is in the hands of black companies. And so that is what the majority of people are excluded from the economy. That Honourable Member Wiley's radical transformation to ensure that all...
Honourable Minister,
oh, sorry.
Can you just take a seat? Can I recognize? On what point are you rising, Honourable
Thank you,
Kalakis?
Deputy Chairperson. I would like to know whether the Minister would take my question.
No. You can ask me as I walk out. Having said that, I would like to fix the Guptas are 7% of the 27%, if that's the question you asked me. I particularly ask these questions because I too see the allegations in the public space. And all those, I wasn't there when you were there.
Honourable members, can you avoid the dialogue?
I wasn't part of an apartheid state when you were part of an apartheid state. I'm trying to fix it now. So having said that, and don't feel precious about this, we know what happened to poor whites in this country. They worked for Spoornet, they worked for ESCOM at the expense of our children. And all we're trying to do now is to, and I'm very pleased that many members in the ANC well, they're not here now, but many members in the ANC have raised the fact that state-owned companies are not stuff that we should be playing with. We must investigate the allegations of corruption. Those who must be charged must be charged. Those who must go to jail must go to jail. And then we must move on. We must continue to electrify everyone's home so that by 2025, every person has access to electricity. And my sister over there, I'm very pleased, the Premier of Eastern Cape has actually signed a deal with us because Eskom can electrify about 200,000 households a year. And they can't go more than that. So what we've done is we've gone into agreement with some of the provinces so that we actually go into what the Honourable Member Prince has raised, into especially rural areas. You asked me, Honourable Member Prince, have we done anything in the Western Cape? Let me just talk a little bit about the CSI, because there's a popular belief that we're taking CSI, like food parcels, into like ANC strongholds. Just recently, I went to George. 5 high schools, the only 5 high schools that were not ex-model high schools. We were able, in the area, to fix a fence, to put in hailing across, voice speaking across all the principals. We could help with the hostels in the area. We also ensured that each girl child would have a sanitary or dignity package every single month. And that's what we continue to do. Is it an ANC stronghold? No. But the lies continue, like the Honourable Member Julius, in his self-righteousness, gets up here and says, and because you're governed by powers and privileges, you say it into the you say it. You say, I don't trust this because you've appointed these people, Minister. Did the Guptas tell you to appoint? Let me tell you, appointment processes are very, oh, you also called my department corrupt, by the way, without any proof of whether or not they're corrupt or not. But you use your right as an MP to do so. And that's all your right. That's what we in the ANC has fought for, that you will never be locked up because you tell lies. And that's what we fought for. So what I want to say here today is that...
Honourable Member, Honourable Minister, can I just take a point of order?
Thank you, Deputy Chair. I think you know what I'm about to say. The member said I'm lying.
I'm sorry.
I'm sure you
she's
heard
withdrawing.
it. I'm sure you heard it.
She's withdrawing.
I'm withdrawing the word lies for economic with the truth. And following on, fools multiply when wise men or women remain silent. I hope you understood that. So let me go back to the issue of corruption. Allegations will be followed through. The President has said, the Deputy President said today in the National Assembly, the President has said he will do so as well. In fact, the Honourable, let me just make another point. You know, the self-righteousness of the DA really ceases to amaze me, or never ceases to amaze me. Then the other day, I read an article, a small article in one newspaper of all the new media, that the Premier has actually kickstarted her son's business with 150 iPads. And I wondered if it was true. So I wondered if it was true. Let me also just fix another untruth.
Honourable Klimbi, what is wrong? Can you please be in order? Because I've got an interest to hear what the minister is saying. Honourable Prince, Honourable Klimbi, in that corner, can you please just be orderly?
Let me tell the Honourable Member Wiley that bid window 4 and 4.5 has not been stalled. In fact, the only difference is that we want a different pricing structure. I don't think it's right for us to pay. It costs Eskom 34 cents to produce 1 megawatt. Not 1 megawatt, 1 kilowatt. we spend as ESCOM 284 rand per megawatt, per kilowatt from IPPs, and we're only able to sell it for 82 cents. Now, all I'm saying is, let's find a different medium in which to do so. So we have signed up, ESCOM has signed up to window 3.5. We must be able to spend 72 cents per kilowatt, so that it actually matches what we pay for it. It will still be expensive, but we still have to do it.
As you round up, can I just take the point of Honorable Mbomba?
Deputy Chairperson, I would like to know if Minister is treated differently in terms of time, because the 3 minutes has long been gone, and I would like to know, I know you've been lenient even with the others with a minute or a half, but Minister has got more than 4.5 minutes already, more. Is the Minister treated differently than other honorable members?
I've got your point.
I just wanted to raise that point, Honorable Chairperson.
I've got your point. Honorable Minister, can you just round up?
Can I just thank all members who participated in the debate? Thank you very much.
Thank you very much. Honorable members, why are you standing, Honorable Mampur? Okay. No, that's fine. Thank you very much. Honorable members, that concludes the debate. And as our agenda house, I'm told that the buses are outside. They are waiting for members to take them to their homes. The house is adjourned.